Hello everyone, thank you so much.
Bonjour à toutes et à tous, merci beaucoup d'être de nouveau avec nous pour
Policy Dialogue on Social Protection and Development, which is co-organized by the OECD Development Center and USP 2030. I'm Antoine Bonnet from the OECD, and I will be facilitating the flow over these 2 days. Yesterday, we have discussed how social protection can shield from inflation and environmental degradation. And today we will explore how these two crises push us to revisit two long debated questions. First, we will discuss the question of universalism versus targeting when it comes to social protection. And second, we will discuss how social protection can allow people to sustainably escape poverty. Now, I would like to introduce you to the moderator of the next session, Valérie Schmidt. Valérie, you are Deputy Director for Social Protection at the International Labour Organization. You're joining us from Geneva. The floor is yours.
Thank you, Antoine, and good morning, good afternoon, good evening even for our colleagues in Asia, and welcome to this second day of the OECD and USP 2030 Social Policy Dialogue on Social Protection in times of growing vulnerability and poverty crisis. So my name is Valérie Schmidt. I'm the Deputy Director of the Social Protection Department at the International Labour Organization. And it's my great pleasure to be your moderator for this first session of this policy dialogue. In this session, we will discuss the respective roles of targeting and universal approaches in the context of increasing social protection demand. So the issue of targeted versus universal approaches to deliver social protection has long been debated. As you all know, targeted approaches concentrate benefits on the poorest people, and they aim, of course, at a cost-effective use of scarce government budget. However, people, as you know, move in and out from poverty, which means that targeted approaches can fail to cover those who should be entitled to social protection. So this may lead to frustration, tensions, and social injustice. So evidence also suggests that universal approaches, on the other hand, such as universal child benefits and social pensions, have better poverty and redistributive outcomes, especially in countries where the majority of the population lives in poverty, is vulnerable, and is affected by shocks and stresses. So during this session, we will discuss and share experiences of countries that have used either targeted approaches or universal approaches or a mix of both in their efforts to build their national universal social protection systems. And so this is why we have invited government representatives from 4 countries, illustrating different approaches to extend coverage of social protection. So allow me to introduce them to you. So we have Mr. Farkani Noor. He's the policy officer at the CEO's office of the social security organization called SOCSO in Malaysia. Welcome. We also have Mr. Dr. Ousseynou Diop, who is the director of the Single National Register, le Registre National Unique in Senegal. Dr. Diop, you want to put your camera on? I don't know if he managed to join us already. I don't see him with the camera on, but I hope that he will. I know he had some difficulties in joining. Okay. Okay, so let's see. And we have Professor Gufron Mukti, who is the Director General of BPJS Health in Indonesia. Welcome.
Thank you.
And last but not least, we have Mr. Alexis Rulissa, who is the head of the CBHI of the Rwanda Social Security Board. Thanks, Alexis. Their interventions will be followed by a reflection on the presentations from Mr. Ruslan Yemtsov, who is the lead economist on social protection and jobs at the World Bank. Ruslan? Great. So after these interventions and Ruslan's comments, you will be invited to engage in an open discussion by submitting your questions to the panelists. So to begin the session, I will invite each speaker to briefly describe their program or their scheme at the national level, the target group, the coverage it has reached so far, the main elements of the scheme design, and in particular, whether it's targeted or universal or, and then how this program or this scheme fits into the overall architecture of the social protection system. What are the challenges, if any, and some ideas for reforms, or some reforms that are already being undertaken in the country to improve this scheme or this program. So our first speaker today is Mr. Farkani Noor, Policy Officer at the CEO's Office of Malaysia's Social Security Organization, SOCSO. Mr. Noor, thank you for joining us for this session. So Malaysia is currently extending contributory social security to groups of workers with contributory capacity, such as migrant workers, domestic workers, the self-employed, and also part-time workers. So these workers, if I understand well, were so far excluded from the social protection system. So could you please share your experience with us? And you have the floor. Thank you.
Thank you so much, Valerie. Can you hear me?
Yes, we can hear you.
Yes, Valerie? All right, cool, thanks. All right, so just to introduce PERCASO a little bit, under the Ministry of Human Resource, PERCASO is a social security organization that basically administers social insurance coverage. I think Valerie correctly mentioned that it's a contributory program. So everyone has to contribute it in order to be eligible for the benefits. Now, what we cover mainly through the pooling of resources and sharing of risk is work injury, invalidity, death, survivor's pension, and loss of employment. So originally, our benefits were mainly cash benefits. So we give cash as a replacement of income to prevent them from going into poverty. But more recently, our strategy has actually been trying to shift away from non-cash assistance, mainly things like rehabilitation and employment services, where we manage injured case workers, unemployed workers, job seekers, sick workers, just to get them to return to work. Now, of course, relying on the original tripartite model, we have a contributory system that enforces the law for any worker with an employer-employee relationship to be covered by PERCASO, right? So this applies to mainly 7 million out of the 15 million roughly working population, active labor force. Now, realizing that the initial coverage is probably about 45 to 50% of the active labor force, PERCASO gradually, like Valerie was mentioning, expanding our coverage to government contract workers. We have the self-employed group from the informal sector, migrant workers, domestic workers, and then most recently, actually, the housewives. They were recently covered, but we just started that scheme, so I won't get there so much. Currently, we cover about 62%, I think 62, roughly 63% of the active labor force. The remaining population is uncovered, basically those who are either in the informal employment, unregistered business owners, unpaid family workers, maybe undocumented migrant workers, basically of that sort, people who are unregistered, I guess. But some of our schemes are actually on voluntary basis, so there is still some challenges. And how we fit basically into the whole ecosystem is that we cover, like I mentioned earlier, 5 out of the 9 branches within the ILO 102 convention. We have, other than PERCASO, we have the Employees Provident Fund that covers retirees. We have targeted poverty alleviation programs for family benefits, and then we have legislative protection for sickness and maternity. We also have a big universal healthcare system, all of which have its own challenges in the Malaysia ecosystem, but I'm just trying to give you guys a picture of how we fit into the overall system. I think PERCESO is partially, I mean, gradually extending legislative protection to all these different type of workers, partially due to demand actually for social security in general, rising, number of gig workers has created somewhat a political will for PERCESO to actually cover the informal group. We eventually covered basically all of the informal sector rather than just gig workers. I think COVID-19 disproportionately affected a lot of the uncovered population. So even people like in the care economy, whether you're domestic workers or you are a housewife, demand for care has increased, especially when people had to start working from home, etc. So that actually created a lot of shift and political will for us to then look at these groups that are uncovered. So if you look recently, the reforms was in 2021, and again in 2022, this year we covered housewives. So you mentioned also migrant workers, Pak Gufron, one of our colleagues, actually, we collaborate to protect migrant workers from Indonesia mainly, partially also because during the COVID-19 pandemic, a lot of the clusters for COVID-19 was also because of the mistreatment that we give towards our migrant workers. So even then, yes, the COVID-19 actually precipitated this whole political will to ensure that our coverage is not towards just formal workers, but to everyone. Now, having said that, there are a lot of different challenges when thinking about self-employed, informal workers, and the likes. It wasn't easy. I think a lot of us had to change our mindset, right? We couldn't enforce just employers directly. We had to basically get off our desks and go to the ground, basically, right? And actually engage directly with eligible beneficiaries. Now, this was initially very challenging, but I think with also technology in general, that allowed a lot of us to be more mobile in processing cases in real time, actually engaging with beneficiaries, directly identifying them on the ground itself. We also introduced more flexibility in contribution payments. So there was a lot of adjustments that were done in order to cover select group, partially also maybe because they don't have the traditional employer-employee relationship. Their burden of contribution is much higher. Source of contribution as well, is very much shifted towards them itself. So what we did was we also matching contribution initiatives, contribution grants, especially for certain selected group of workers that are more vulnerable than others. And eventually we were able to cover more and more people into the scheme. Now, currently, some of our schemes are still voluntary in nature. Especially for the self-employed group, we are actually slowly, gradually making it mandatory. But ultimately, we want to make it automatic, right? We're always complaining that, you have to get a car insurance before you buy a car. Why can't you get insurance, like social insurance, before you work? Now, with that, I think I touch a little bit of everything.
Thanks a lot. Thank you.
I'll pass it back to you, Valerie.
Yeah, thanks, and right on time. So thanks a lot for this very synthetic explanation of what is going on in Malaysia and this scheme, which is to extend contributory social security to groups of the workers that were so far excluded. This issue of this main issue of the political will that really helped Malaysia in undertaking this very important reform, and also all the challenges that you faced and that you managed to overcome partially, and the remaining challenge, which is still the voluntary nature of this social protection. So thanks a lot, Mr. Noor. I'm just checking whether we have Mr. Diop with us, or whether he has
Bonjour, je suis avec vous.
Bonjour, Dr. Hussein
Bonjour.
Diop.
Bonjour.
Merci
Antoine.
beaucoup de nous rejoindre. J'ai vu que vous aviez eu quelques soucis de connexion.
Oui, oui.
Bon, ravi de vous revoir puisqu'on s'est vu la semaine dernière à Dakar.
Ouais.
Et merci donc de participer à ce panel. Donc, vous êtes le directeur du registre national unique au Sénégal, au sein du ministère du Développement communautaire et de l'équité sociale et territoriale. Donc, le RNU, le registre national unique, est vraiment la base de données au Sénégal qui permet, à laquelle sont attachés différents programmes d'assistance sociale, donc non contributifs, qui visent à offrir une protection aux familles pauvres et vulnérables, à différents groupes de la population aussi, les personnes avec des handicaps, les personnes âgées, etc. Si je comprends bien de nos discussions de la semaine dernière, la crise de la Covid a montré la nécessité d'étendre le RNU dans la mesure où un grand nombre de familles vulnérables se sont retrouvées dans une extrême précarité en raison de la crise. Donc, nous sommes ravis de vous avoir sur ce panel. Et si vous pouviez donc nous expliquer un petit peu où en est le RNU et quelle est cette approche, quel est ce mécanisme qui permet effectivement d'étendre la protection sociale, la couverture de protection sociale au Sénégal. Donc, à vous la parole. Merci.
OK, merci. Bon, j'avais quelques problèmes de connexion, mais c'est finalement réglé. Donc, bonjour à tout le monde. En fait, le Sénégal, c'est un pays de l'Afrique de l'Ouest, pour ceux qui ne connaissent pas, de 17 millions d'habitants en moyenne. Et nous avons un taux de pauvreté qui tourne autour de 40% en moyenne de la population, ce qui nécessite aujourd'hui de concentrer quand même des interventions sociales pour un peu protéger les ménages pauvres et vulnérables. Donc, c'est en 2015 que l'État du Sénégal a décidé de mettre en place un instrument de ciblage qu'on a appelé un registre national unique, qui est rien d'autre qu'un registre social qui permet en fait d'avoir une base de données dynamique qui est fait à partir d'un processus d'identification et de sélection des ménages qui sont en situation de pauvreté. Bon, depuis quelques années quand même, 2 ans, nous avons quand même changé de paradigme en ne se concentrant plus sur ce qu'on appelle la pauvreté, mais en élargissant et en intégrant ce qu'on appelle la vulnérabilité. Et la COVID a été un déclic, parce que la COVID nous a montré qu'aujourd'hui, il ne s'agit pas de se concentrer sur les ménages peut-être pauvres seulement, mais qu'en cas de choc, comme ce qui est arrivé lors de la COVID, et même actuellement avec les chocs, avec l'inflation, les coûts, nous avons remarqué qu'il y a beaucoup de vulnérabilités qui émergent. L'autre aspect aussi, c'est que le Sénégal, à l'instar d'autres pays quand même, fait face à ce qu'on appelle au changement climatique. Et nous avons beaucoup de populations qui sont dans des situations où ils font face à des vulnérabilités liées aux incendies, aux inondations, au déplacement de population. Et donc, du coup, nous avons mis en place un outil qu'on appelle le registre national unique, qui est un instrument de ciblage et qui permet aujourd'hui, où on a concentré près de 30% des ménages du pays. C'est-à-dire aujourd'hui, nous avons une base de données où l'ensemble des informations, aussi bien du ménage que des individus qui composent le ménage, sont renseignées. Et le RUD est aujourd'hui un instrument central dans la mise en œuvre des politiques sociales du gouvernement. Si je prends en résumé, nous avons dit que le RNU nous permet déjà de disposer d'une base fiable et consolidée des ménages vulnérables. Ça permet aussi, en cas de choc, d'agir rapidement au sein des ménages. Par exemple, aujourd'hui, le RNU a été utilisé lors de la COVID parce que l'État du Sénégal avait identifié un programme national d'assistance aux ménages vulnérables et on a utilisé cette base de données, ce qui nous a permis rapidement, en 1 mois, d'intervenir sur l'ensemble du territoire parce qu'on avait une base de données avec des informations renseignées partout. La dernière intervention d'envergure, c'est on a fait une opération de cash transfert exceptionnelle où on a donné un montant de 80 000 francs CFA, c'est en moyenne, je pense, 100 €, qui permettait en fait d'agir et de donner un appui financier, un cash transfert non conditionnel pour un peu renforcer les pouvoirs économiques des ménages vulnérables et peut-être booster un peu la consommation. L'autre aspect aussi, c'est que le registre national unique, s'il est bien utilisé, ça permet aussi de renforcer la mise en cohérence des politiques publiques parce que, comme on le sait, la pauvreté, c'est un paquet de privations. C'est un ensemble de privations au sein du ménage et nous travaillons, par exemple, avec la couverture maladie universelle pour assurer une couverture au niveau de ces ménages. Nous travaillons aussi au niveau des communautés pour faire des cash transferts. Et il y a tout un travail aussi d'autonomisation des ménages qui est fait pour renforcer en fait les capacités d'autonomie financière et de productivité. Donc, nous avons aussi développé ce qu'on appelle des programmes de protection sociale productive aujourd'hui qui permet aux ménages d'avoir une capacité économique et de renforcer leur capacité financière. Mais au-delà, il y avait aussi des appuis non financiers. C'est tout ce qui est leadership, renforcement de capacité, estime de soi pour renforcer un peu le capital humain et la capacité des ménages pauvres à être des acteurs économiques en plein temps. Maintenant, quand on dit qu'aujourd'hui, nous avons une base de données qui concentre 30% des ménages du pays et peut-être 77% des ménages pauvres, parce qu'il y a aussi les erreurs d'inclusion et les erreurs d'exclusion nécessairement quand on fait un ciblage, la question qui se pose, c'est que comment on a conçu, comment on a choisi ces ménages. Donc, le choix de ces ménages, c'est fait de façon graduelle. Le premier niveau de choix, c'est au niveau village et quartier. Au Sénégal, bon, pour ceux qui ne connaissent pas, il y a 14 régions, 46 départements et près de 500 et quelques communes. Donc, dans chaque commune, nous avons des villages et des quartiers. Donc, dans chaque quartier et village, ça tourne autour de 26 000 comités de ciblage dans tous les pays. Nous avons des comités de ciblage qui permettent de renseigner l'ensemble des collecter les données au niveau de ces ménages et de les remonter au niveau communal. Déjà, il y a 36 000 comités de ciblage. Ensuite, ce travail fait, supervisé et remonté au niveau communal. Il y a 500 et quelques niveaux au niveau communal. Ensuite, ça remonte au niveau des départements jusqu'au niveau national. Et c'est là où on a conçu une base de données où l'ensemble des informations sont collectées. Et c'est ça qui permet de partager ces informations avec l'ensemble des ménages, l'ensemble des projets et programmes. Maintenant, récemment, en 2021, quand même, le registre national unique a été ce qu'on appelle institutionnalisé. Bon, quand je parle institutionnalisé, ça veut dire qu'il y a un décret qui a été pris pour en faire l'instrument par excellence de ciblage de toutes les interventions au niveau du Sénégal. C'est-à-dire aujourd'hui, toutes les interventions de protection sociale utilisent la base de données du RNU. Nous avons aujourd'hui une vingtaine de projets et programmes qui utilisent cette base de données, et que ce soit la santé, que ce soit l'accès à l'éducation, que ce soit l'accès à l'assainissement, que ce soit l'accès à l'énergie. Tous ces projets et programmes utilisent cette base de données qui est la base de données du registre. Merci. Maintenant, en termes de perspective,
rapidement, rapidement, parce que vous êtes déjà au-delà du temps imparti. Allez-y.
Oui, une minute. Hein. Maintenant, pour terminer, la COVID nous a montré que, comme je l'ai dit, il faut aller changer de paradigme et élargir. Donc, nous allons faire 1 million de ménages, pratiquement 55% des ménages du pays où l'ensemble des informations seront collectées. Et pour nous, ça va renforcer la mise en cohérence des politiques publiques, ça va renforcer l'équité, mais aussi ça va permettre au gouvernement d'être plus efficient en cas de choc pour pouvoir atteindre les ménages les plus affectés. Donc, globalement, c'est ce que je voulais partager avec vous sur un instrument qui a été développé depuis 2015 avec l'appui des partenaires, notamment le BIT, la Banque mondiale, l'UNICEF et d'autres partenaires, et qui aujourd'hui permet un peu de mettre en cohérence l'ensemble des politiques sociales. Merci.
Merci beaucoup, Dr Diop. Merci beaucoup pour cette explication de ce mécanisme qui est de plus en plus inclusif avec votre volonté d'atteindre 1 million de ménages, 55% de la population du pays. Ce mécanisme qui est basé sur le droit également, puisqu'il y a ce décret qui lui donne une assise légale, qui facilite pas seulement l'accès à la protection sociale, mais des approches plus intégrées d'inclusion sociale et de développement aussi des micro-entreprises, etc. Et ce mécanisme de ciblage également qui est très intéressant, ciblage communautaire. Donc, merci beaucoup pour votre témoignage. Donc, it's now time to move to our third speaker. So Professor Gufron Mukti, who is the Director General of BPJS Health, Indonesia's social security administrative body for health. So Professor Mukti, thank you so much for your participation in this session. So through the Jaminan Kesehatan Nasional, JKN, which is a single payer and mandatory scheme, Indonesia has successfully extended health insurance coverage to more than 80% of its population over the past 10 years. So, and this of course includes the extension to the informal economy workers. So this breakthrough was made possible, among others, thanks to the use of innovative financing mechanisms, combining social security contributions and subsidies as well for the poorest households. So Professor Mukti, you have the floor. Thank you.
Thank you, Valerie, for everyone. First of all, I would like to thank. So in Indonesia, actually, when we are talking about social security, actually, there are three types. First is that basically contributory social security. And for the contributory social security, we have two things. First, social security program for workers, and then social security for health. And non-contributory, which is like cash transfer and government of Indonesia have providing cash to the condition to the families. This was non-contributory and conducted by Ministry of Social Affairs. So now back to the contributory social security. And for the contributory social security for workers, there are social security which cover more than 50 million. And this includes work injury benefit, life insurance, old age benefits, and also pension benefits and job loss insurance. And now we talk about contributory social security for health. And for health, as mentioned by Valerie, that we actually now covered more than not only 80%, but almost 90%. So 89.7%, so almost 90%. So this, cover around 246 million people. It means maybe it is the biggest and the largest health insurance program in the world with a single schemes and carried out by single payer institution approach. And of course, as you mentioned that there are members subsidized the contribution by the government because they are poor and for the poorest, and also those from informal sector. For informal sector, they have to pay, but which little bit subsidy, less than $1 subsidy, but they have to pay. And for the workers, for formal workers and government workers and other type of workers, where they have to pay for wage workers, they have to pay 1%, and the employer pay 4% of the wage or salary. And of course, now, when we are talking about the program framework or mechanism, the scope of the social security in health for health sectors, we give the not only benefit package from primary healthcare, but up to referral hospitals, both private and public hospitals. And of course, there are contribution, and we have a tariff which set the standard by the Ministry of Health, and then we negotiate with association of healthcare providers, both in primary care or in the hospitals levels. And of course, that hospital will claim to the, we call it Social Security Administrating Agencies, or we call it BPJS, and they claim to BPJS, and we pay less than, around 2 weeks or less than 2 weeks. And, for the elective surgery, they can have less than, in average, less than a month. If emergency, they can go to any type of hospitals across the country. And the good thing that now the members can have access not only using the membership cards, but they can use identity numbers as the citizen of Indonesia, if, of course, they are the member. So we work together with many stakeholders across the country, with both the private and publics. And now we have more than 650,000 channels of payment, working with the bank, with the institutions and the cadre. For example, like the new type of ecosystem of technology, like Copay and OVO, and many type of that new type of technology. And we know that Indonesia may be the biggest country with archipelagic country, because we have more than 17,000 islands. So that is, of course, the challenge about the equity, because the pace of development across the country is not the same. So the challenge of equity is really not simple things. And now we develop what we call it a digital ecosystem, that the person or the member can access to the health facilities from home. Even they can change their health facilities from home. And we have the queue system online, so they can queue from home also. And of course that we have telemedicine, and now implemented and still in piloting around 117 hospitals across the country and on the primary healthcare. And there are many challenges, as I mentioned, because we have to, serve for 17,000 islands with different pace of development. And therefore, we are now, again, our challenge to develop digitalization ecosystem, integrated service transformation solution. And this digitalization will function not only enabler, but also facilitator and accelerator, that the patient and also the members maybe have a more better quality of care, because more flexible. And teleconsultation, where now more than 17 million people already used the teleconsultation. But of course, the challenge in the remote area where the connection is problem, there is a challenge. I think that is all, Valerie, because of the time. Thank you very much.
Thank you so much. That was very, very interesting. I'm sure many participants have tons of questions for you. So thanks a lot for sharing this experience and this successful experience of extension, which also is based on solidarity in financing, digitalization, and a solid network of healthcare providers. So thank you so much. And so I will now turn to our fourth and final speaker today, who is Mr. Alexis Roulissa. Allô? Ah.
Allô?
Oui, Alexis, vous êtes là. So in English or in French?
Okay, in French.
Okay, donc vous
But
êtes...
I may answer questions in both. English and French.
OK. So, vous êtes le responsable du CBHI, des Community-Based Health Insurance Scheme, qui fait partie du Rwanda, du système de sécurité sociale au Rwanda. Et comme l'Indonésie, vous êtes arrivé à couvrir, à étendre la couverture pour la protection sociale en santé, l'assurance santé obligatoire à 90%, pratiquement 100% en fait de la population du Rwanda, qui est couverte au travers de mutuelles de santé. Cette stratégie d'extension a été vraiment un succès grâce à de nombreux éléments dont vous allez nous parler, dont des campagnes d'information, dans la simplification des procédures et bien entendu l'adaptation des niveaux de contribution aux capacités, des capacités contributives des participants à ce système. Donc, merci beaucoup, Monsieur Roulissa, d'être avec nous aujourd'hui et donc vous avez la parole. Merci.
Merci Valérie. Comme vous venez de le signaler, donc je travaille au sein de RSSB, l'Office rwandais de sécurité sociale, qui gère non seulement l'assurance maladie du secteur formel et du secteur informel, mais aussi les régimes de pension, de risque professionnel et d'assurance maladie maternité. Et donc le programme dont je vais vous parler aujourd'hui, ou le dispositif, c'est le dispositif des mutuelles de santé communautaires. Les mutuelles de santé communautaires, au départ, c'était des initiatives communautaires ici et là, mais elles ont été regroupées en un seul régime au niveau national à partir de juillet 2015. Et c'est à partir de là que la gestion a été confiée à l'Office de sécurité sociale qui gérait à l'époque aussi l'assurance maladie des fonctionnaires et agents de l'État. Donc, ce dispositif concerne le secteur informel et rural. Ce secteur concerne plus de 90% de la population, mais actuellement, le nombre de personnes couvertes s'élève à 11 millions, ce qui représente 88% donc, de cette population du secteur informel et rural, ce qui s'ajoute à ceux qui sont couverts par d'autres régimes d'assurance maladie. Donc, les mutuelles de santé qui couvrent le secteur informel et rural, au sein de RSSB, avec les salariés du secteur formel, c'est-à-dire les fonctionnaires et agents de l'État, couverts aussi par RSSB. On a aussi le régime des militaires, c'est-à-dire les militaires, la police nationale et tous les agents de sécurité qui sont regroupés au sein de l'assurance maladie des militaires, Military Medical Insurance, ou MMI. Et en plus de ces dispositifs d'assurance maladie, il y a aussi d'autres régimes de sécurité sociale comme les pensions, risques professionnels, assurance maladie, ce qui complète aussi, donc ça c'est le volet contributif et ça complète le volet non contributif, notamment les programmes d'assistance sociale en faveur des personnes vulnérables. Ce qui concerne les personnes vulnérables, on a deux cas. Le premier étant les victimes du génocide qui sont couverts pour le régime d'assurance maladie par un fonds qui est financé essentiellement par le gouvernement rwandais, et aussi les personnes vulnérables qui sont financées non seulement pour l'assurance maladie, mais pour la catégorie socio-économique des indigents qui reçoivent des aides directes ou qui sont embauchés dans des travaux de haute intensité de la main-d'œuvre. Les défis que nous rencontrons jusqu'à aujourd'hui, parce que le régime de mutuelle de santé, c'est un régime à base volontaire, il nous faut faire une mobilisation de la population pour qu'elle puisse adhérer volontairement, parce qu'on ne peut pas forcer. Il y a aussi le risque de sélection adverse, parce qu'avec le risque de sélection adverse, vous avez seulement les personnes à haut risque maladie qui sont adhérées, mais les personnes qui ne présentent pas le risque actuellement préfèrent ne pas contribuer et elles viendront dès qu'elles ont eu un accident de circulation ou s'il y a une maladie pour se faire soigner. Et aussi avec les risques de revenus des ménages qui sont irréguliers et difficiles à prédire, ce qui est contraire au régime des fonctionnaires et travailleurs salariés qui reçoivent un salaire facile à prédire chaque mois. Parmi les prochaines étapes, nous sommes en train d'élargir la gamme de prestations ou le panier de soins parce que le régime de mutuelle de santé ayant un financement qui n'est pas suffisant, on a un paquet de services qui est très limité, alors que les autres régimes, notamment pour les fonctionnaires agents de l'État, pour les militaires et aussi pour les assureurs privés qui couvrent les travailleurs du secteur formel privé, ils ont un panier relativement complet qui comprend tous les services disponibles dans le pays et même des évacuations sanitaires pour certains plans des assureurs privés. Nous sommes en train donc d'informatiser tout le processus à partir donc de l'immatriculation et la gestion des membres, l'identification des membres éligibles au moment de chercher les soins à l'hôpital, la dispensation des soins, la facturation de l'hôpital à l'assureur et puis la vérification et le paiement des factures de l'assureur à l'hôpital. Nous sommes en train donc d'introduire le renforcement de l'achat stratégique par rapport à l'achat passif. Au départ, on avait mis un accent particulier sur la mobilisation de la population pour adhérer afin d'arriver au système universel. Mais pour le moment, on est en train donc de viser l'efficacité ou l'efficience en introduisant la notion d'achat stratégique. Et en fait, donc, on a une réforme profonde concernant le mécanisme de paiement. Pour le moment, on utilisait le paiement par acte, donc le paiement au prestataire. Par acte, c'est-à-dire que chaque acte était facturé séparément, consultation, examen de labo, imagerie, médicaments. Mais pour le moment, on tend vers la capitation qui va commencer au mois de janvier 2023, là où les membres assurés vont être recensés et affectés dans leur centre de santé respectif et un montant par capita va être versé sur le compte du centre de santé au début de l'année et le centre de santé va se débrouiller pour traiter de façon efficace tous les membres qui sont inscrits là-bas. Et finalement, l'étape qui va suivre, ce sera donc l'introduction du paiement par groupe de maladies, Diagnosis Rated Group, ou DRG, au niveau secondaire et tertiaire, c'est-à-dire au niveau des hôpitaux de district et des hôpitaux de référence. Grosso modo, donc, le système de mutuelle de santé a aidé le pays à atteindre un taux de couverture de plus de 90% de la population rwandaise, en plus de ceux qui sont couverts par le régime des mutuelles de santé, le régime des militaires et puis les assureurs privés, même si le panier de soins qui est couvert n'est pas encore satisfaisant pour tous les membres, mais on essaie encore donc d'élargir cette gamme parce que récemment, on a introduit des sources de financement innovants. On a une liste de 16 sources qui ont permis que les mutuelles de santé ne sont plus déficitaires. Quand on avait introduit ce système en 1999 jusqu'en 2019, c'est-à-dire 20 ans, donc on faisait 20 ans avec des déficits chaque année, mais à partir de 2020 jusqu'à aujourd'hui, on vient de faire 2 ans, c'est maintenant presque 3 ans, qu'on termine l'année fiscale avec un excédent grâce à ces sources de financement innovants. Je vous remercie.
Merci beaucoup, Alexis Roulisa, pour ce partage. J'imagine qu'il y aura énormément de questions aussi sur votre présentation, comme sur les autres, dans la mesure où ce système rwandais est à la fois un succès et en même temps suscite beaucoup de questions, notamment sur comment parvenir à cette couverture quasi universelle au travers d'un système qui est encore sur une base volontaire. Donc, merci beaucoup. I would like now to introduce our discussant for today's session. So, Mr. Ruslan Yemtsov. Mr. Yemtsov is the lead economist for social protection and jobs at the World Bank. And prior to this, he occupied the position of Human Development Program Leader for China, Mongolia, and Korea. And during his career at the World Bank, he also worked in the Middle East and North Africa region, and as well as in the Eastern Europe and Central Asia region. So he has a lot of experience on social protection. So Mr. Yemtsov, thank you for taking part in this session, and the floor is yours. Thank you.
Thank you. Thank you, Valerie, and thank you all colleagues for wonderful presentations that shed really good light on how different countries with very different context, with very different challenges are approaching the challenge of universal social protection. All of the presentations were extremely relevant because they are showing different facets of extension of coverage to the new groups. And I would like to note here a very important fundamental distinction that we are talking about. So on one hand, we are talking, when we talk about social protection, managing risks. And those risks are well known. Those risks are related to the life cycle risk. They're also related to the risks of health, related to health, or risk related to work. These are well codified. These are well known. There is an institutional memory behind expanding each of these forms. And each of the forms is complex. Old age protection, protection of income in the old age is one particular challenge. Ensuring the ability to pay for health services, and also ensuring protection of income of people who are suffering from illnesses is a very different challenge too. The coverage of disability and related income losses is another form. So all of these forms are extremely important because the risks are widespread. They affect practically everyone in the population. That's why we keep on arguing that social protection needs to be universal, because potentially everyone in the society, in the population, will need at certain point direct support. And in order to provide this direct support, these people need to be included in the programs. And so we heard very interesting case of extending pension coverage in Malaysia, really fascinating case about the health insurance in Indonesia, and the case of Rwanda. And we see that all of these countries are pursuing a very gradual approach in terms of they're being extremely pragmatic, and they're seeing within each sector how both the extension of coverage or the width of the coverage can be combined with the deepening of the coverage, right? What kind of risk health insurance is covering? What is the package? How it is financed? What are the structure to collect contribution? What is its degree of the subsidy? How the payments to providers are managed, and so on. These are all extremely complicated and extremely relevant things, which depend, obviously, on the institutional setup of each country. That's why we keep on saying the route to universal social protection is very country-specific. And those were great illustrations. There are important questions in this route. So one question is what I just mentioned, how the gradual expansion of width of coverage can be combined with deepening the coverage. But there is also a question about how to manage this complex system, which by design is pragmatic. Therefore, one needs to work on the margin. One needs to utilize what is already there in order to solve practical problems. But then it leads to fragmentation. And we heard it in particular in the case in Rwanda, where different groups have very different packages, very different coverage, how these things can become more coherent, more cohesive over time. Because one of the objectives of social protection is actually ensure this social cohesion. So those are important things to address. But on top of these risks that are well known, with the known instruments that the countries are trying to adjust to the reality of informal economy and adopt innovative solutions, including the technology. On top of this, there are also other risks. the model which limits social protection to the protection against those risks assumes that people who have a job basically are well covered. They don't need any extra assistance. And the reality of the countries as Senegal and Rwanda as well as many middle-income countries that we heard, is that a lot of workers are in the informal sector, and even without being exposed to risk, they're already suffering from deprivation. This deprivation is leading to a cycle of intergenerational transmission of poverty. It limits the abilities of countries to grow, to invest in human capital, utilize the human capital as a productive force, and therefore countries are seeing a different form of social protection where direct non-contributory programs are put there to accelerate the transition of these people to a more sustainable participation in the social protection system overall. Therefore, when we talk about universality, we're seeing the multiplicity of schemes. The system has to be universal. Each particular scheme addresses specific risks or specific misfunctions in the social fabric. And so the experience of Senegal is extremely interesting on how gradually the social registry is expanding to cover those that are poor even without exposure to risk, and protecting them against the risk is even more important because each risk is putting them on the brink of destitution and a complete lack of means to function properly as members of society. So therefore, this new instrument has a combination of factors. It tries to help people to move away from poverty, move away from dependence on assistance, but at the same time, it also tries to bring them into the coherent social risk management system where they can be contributing and where their continued risk can be covered. And so that complexity is actually making the social protection, extending universal social protection, are really, again, very country, very context specific, and very much dependent on the political factors, because there is a very delicate balance. How fast you are going and expanding social health coverage, for example. It requires a lot of resources, as we heard from Rwanda. These resources are limited. How fast you are going to expand the pension coverage with a subsidy element for the informal sector workers, extremely important. But that also means that the resources left to use social assistance as a form of poverty focused programs that help the households to become more sustainable and become part of this society that manages the risk collectively are limited, and therefore those choices, those strategic choices, are always shaped by the political realities and especially by the realities on the ground. The fact that all of these countries mentioned that expansion of coverage is always work with the communities and it's always based on the dialogue with the society is exactly what is happening on the ground when these really hard questions and trade-off are being solved by countries depending on what is their ultimate political objective and how fast they can go. So this is just all from me. I hope we are going to have an interesting discussion. I hope it's an introduction to having a more structured view on the landscape of extending universal social protection. And we see clearly these two complementary avenues that help the countries to leapfrog and take maybe a decade or maybe a few decades to grow universal, developed, deep social protection system as opposed to century. And that is exactly what we are challenged with, because as we know, there are new risks, there is a climate change, there is globalization of the economy, which poses new challenges to all countries, especially the countries in the developing world. Thank you.
Thank you so much, Ruslan, for this very interesting comments. I mean, I think you mentioned a lot of elements that are really close to also our vision and the support that we provide to countries in terms of explaining what is universal social protection, both in terms of coverage and deepening the protection. So looking also at the number of risks that are covered that we call branches at the ILO, and also the level of benefits that are provided. Thanks also for mentioning that social protection system, and this is also based on the example of Rwanda, but to some extent also Senegal and Indonesia, that there is a need to avoid fragmentation of among different schemes, and to really try to build cohesion and coherence across the different schemes and mechanisms. Thanks also for mentioning the main issue of the persistence of the informal economy and the difficulty, of course, to both extend coverage and at the same time empower or ensure that the workers and enterprises in the informal economy can become more sustainable, more productive, and contribute actually to their own to the development of the economy and to their own protection through contributory social security systems. Thanks also for mentioning the necessary trade-off in terms of allocation of resources that are scarce, obviously, and how to actually increase the fiscal space, including through the extension of social protection, contributory social protection to the informal economy. So I think there are many, many excellent and very interesting elements in your comments. And so I guess we have enough meat, enough ideas to now open the discussion. I would like first to thank our speakers and our commenter Ruslan for their excellent contributions to these to the session so far. Now I would like to really open the floor for discussion. So when raising a question, you are invited, of course, to introduce yourself by stating your name, your organization, and also please specify whether your question is addressed to the whole group of panelists or to a specific speaker or to our commenter Ruslan. So I will be taking up to 3 questions at a time, and then give an opportunity for our panelists and commenter to answer. So the floor is open. I see Alexandre who wants to, I need some help because I cannot really see. Attendez. Voilà. So I see 2 hands up, Alexandre and the Church of Sweden. So Alexandre, please come in.
Merci Valérie. J'ai 2 questions. J'ai une question pour Alexis. Alexis, vous avez parlé en fait de financements innovants qui ont permis en fait justement je dirais de retrouver en fait un équilibre financier au niveau des programmes de protection sociale. Est-ce que vous pouvez rentrer un petit peu plus dans les détails de ces financements innovants? J'étais pas sûr d'avoir complètement compris sur quel mécanisme reposaient ces financements. Then I have a question to Ruslan. Ruslan, I think you have a wealth of experience in different regions of the world on social protection. I have a question as regards, recent trends on child benefits. I was wondering whether you have seen actually a move towards towards universal child benefits, or whether you have seen many countries remaining, in a more conservative approach and trying actually to target child benefits on those poor households. Thank you.
Thank you so much, Alexandre. So now I will ask the Church of Sweden to come in with their questions, and then we will go to our panelists and to Ruslan for the answers.
Thank you very much, and thank you for a very exciting panel. I have a question for Mrs. Diop from Senegal. And first I had to say that the expansion that you mentioned was really impressive, and that the RNU is now covering 30% of the households, as you said. I would like, though, to ask whether you have any information on the exclusion rate of the program. As we know, that the exclusion rate of whether you use proxy means test or community targets tend to be quite high. So if you have a comment on that. And also you mentioned that you're addressing new vulnerabilities as they come up. And that really brings us to the question on universal access and universal social protection, as in the end, all of us are vulnerable. So I wonder if you see the RNU as a first step towards a universal system, and then if so, how the pathway to universality would be from the RNU. Thank you very much.
Thank you so much. And we have received in the chat other questions. So for Mr. Diop, it's a question on whether you have, est-ce que vous avez de l'information, des évidences, des données sur le niveau d'exclusion dans le mécanisme de ciblage communautaire du RNU que vous avez expliqué. Voilà. Et sinon, et je pense que l'autre question est très liée à la question qui vient de vous être posée sur le passage d'une approche plus de ciblage à une approche plus universelle du RNU. Donc, je ne vais pas la reposer. Et il y a une question à Alexis Rouliza. Do you have a document, if possible, in English that describes the information you gave on how to expand coverage in Rwanda? Okay, so there are several questions for Alexis, one question for Ruslan, and several questions for Mr. Diop. So I will start with Alexis. Alexis, est-ce que vous voulez répondre aux questions qui vous ont été posées?
Merci Valérie. Donc, je commence par la question d'Alexandre sur les financements innovants. Donc, comme je vous ai dit, c'est une liste de 16 sources. Nous avons un prélèvement donc, de 2,5% sur le chiffre d'affaires des compagnies de télécommunications, 50% des frais de recherche, parce qu'au Rwanda, la recherche dans le domaine médical, on exige une autorisation spécifique du Comité national d'éthique. Donc, pour demander cette autorisation, il faut un paiement de 1 500 €. Et sur les 1 500 €, 750 € sont versés sur le compte des mutuelles et la moitié qui reste, c'est pour le fonctionnement du Comité national d'éthique. Et comme tous les produits pharmaceutiques, les produits médicaux et appareils sont enregistrés à l'entrée dans le pays, donc 50% des frais d'enregistrement aussi sont versés sur le compte des mutuelles. 10% d'amende de sécurité routière, 50% des frais perçus sur le contrôle technique des véhicules automoteurs, 100% d'amende sur le commerce de produits sous standard. Et dans nos pays, il y a la production des produits alcoolisés, production non industrielle, et qui n'est pas autorisée quand les producteurs sont attrapés par la police nationale. Donc, il y a une amende qui est payée par ces producteurs et la totalité est versée sur le compte des mutuelles de santé parce que ces produits sont nuisibles à la santé de la population et quand les personnes malades ou bien les personnes dont l'estomac, le foie ou les autres organes sont complètement endommagés, donc on se rend compte que c'est le régime de mutuelle de santé qui couvre les factures à l'hôpital. Donc c'est pour cela que l'État a accepté que tous les frais d'amende soient versés sur le compte des mutuelles de santé. On prélève aussi 10% sur les services offerts aux sociétés de jeux de hasard. Il y a un prélèvement automatique de 0,5% sur le salaire net de tous les employés, qu'ils soient du secteur public ou du secteur privé. Et il y a 20 francs rwandais par litre de carburant, que ce soit essence ou mazout. Et il y a 4 000 francs rwandais par hectare sur les marais et les terrasses aménagées parce que ça appartient à l'État, mais c'est loué par les agri-éleveurs qui les exploitent. Donc, sur les frais qui sont payés à l'État pour la location donc, de ces marais et terrasses aménagées, il y a 4 000 francs rwandais qui sont versés
Merci beaucoup, Alexis. Et maintenant, pour toutes ces explications, je pense que ce sera effectivement intéressant si vous pouvez partager ces textes qui mentionnent toutes ces sources de financement et d'autres informations sur l'extension de la couverture. Merci beaucoup. Maintenant, Monsieur Diop, vous avez eu plusieurs questions également, si vous voulez répondre.
Ok, merci. En fait, il y a quelques questions sur le taux d'exclusion par rapport au RNU. En fait, ce qu'il faut comprendre, c'est que dans le ciblage du RNU, nécessairement, il y a des erreurs d'inclusion et des erreurs d'exclusion. Bon, nous avions fait une évaluation du processus de ciblage du RNU et nous sommes tombés à un taux moyen de 8%. Bon, ça fait 3 ans comme ça, 4 ans qu'on a fait cette évaluation. Mais ce qu'il faut comprendre aussi, c'est que le processus de ciblage du RNU est amélioré d'année en année. Donc, parce que chaque année, en fonction des évolutions, quand on fait la mise à jour, parce que la mise à jour du RNU se fait de façon cyclique, de grande envergure, tous les 4 ans, l'ensemble des informations sont mises à jour. Et donc, ça permet aussi de corriger les erreurs d'inclusion et les erreurs d'exclusion. Ça, c'était la première question. Par rapport à la vulnérabilité, comme on le sait, hein, il y a aujourd'hui, avec les changements climatiques, avec aussi la COVID, même avec certains conflits internationaux, en fait, il y a ce qu'on appelle des nouveaux formats de vulnérabilité qui émergent. Et du coup, le RNU est aujourd'hui conçu comme un premier pas vers l'universalisation de la protection sociale. Et le Sénégal a déjà travaillé sur cette vision. Donc, on commence par les populations les plus pauvres et vulnérables, mais on va vers une approche universelle et on a même produit un document qu'on a appelé une étude de faisabilité institutionnelle pour mettre en place une caisse autonome de protection sociale universelle où on a fait même des simulations parce que le Sénégal en 2024 en 2022-2023, et on va commencer l'année prochaine, pour être précis, 2023, on va commencer à exploiter le gaz et le pétrole. Donc, on a identifié des sources de financement innovants centrées sur les ressources du pétrole, du gaz, mais aussi une TVA sociale. Donc, il y a un modèle de simulation, il y a d'autres sources de financement, comme l'a évoqué mon ami du Rwanda tout à l'heure. Mais le RNU, en tout cas aujourd'hui, est conçu comme un point de départ vers une approche universelle, mais on commence par les populations les plus pauvres et vulnérables. Merci.
Merci beaucoup, Monsieur Diop, Dr Diop, pour ces précisions. Et donc, maintenant, j'aimerais si Ruslan pouvait répondre à la question qui lui a été posée. Je vois qu'il y a plein d'autres questions à la fois dans le chat. Et donc, après, on ira et des mains levées, notamment Shara. Donc, Ruslan, can you comment on your question? Thank you.
Absolutely. Thank you, Sasha, for an excellent question. And the question was about universal programs for children, universal child allowances or universal child grants. I'm going to reflect on this question comparing two countries I worked for the last 4 years, China and Mongolia. In Mongolia, as you probably know, is one of the few countries that instituted universal child allowances quite a long time ago. And it was meant to be a program that was supposed to support the investment in human capital. It was explicitly called the Fund for the Future Generations. And so the program was financed by the revenues from the natural resources, and Mongolia is very well endowed with a lot of natural resources. And so it was a real concern how this wealth of the nation can be shared in a transparent and clear and inclusive way. And I think the child allowance program in Mongolia really made huge advances, even before other countries have started doing it, by promoting financial inclusion, opening accounts for everyone in the country, including all families with children, providing them with a steady support, modernizing payment systems, and so on. So it is a very well-known program. Surprisingly, there is a constant pressure in the government to do something about lack of targeting. Despite the fact that in its concept, the program was designed as a program of sharing wealth equally between all children, the future generation, there is still an understanding that for poor families, for those at the bottom of the distribution, it's not enough. For rich families, it's redundant because, as the financial data show, most of this money is simply saved, and it's not used in any way. And so there was this constant tendency from different parts of the government to reverse and to make it targeted. What is happening is that each time the government comes up with a plan to restructure it and to target it to or to differentiate the benefit, keep it universal, but let's differentiate the benefits. There is always an opposition in the parliament that basically stops this kind of reforms. This program is extremely politically popular because it's so simple, transparent, and it also offers a very clear vehicle in terms of engaging with the population. The problem with that is instability of its resource base. The benefits can go up and down depending on how much money there is. And it's really inelastic. It's really a hard decision about how much to pay, especially in the inflationary environment with a considerable inflation every year, how often the benefits are adjusted. That leads to huge fluctuation in its real value over time. So it diminishes the argument of predictability that is really important in instituting the universal cash transfer program. With all of these problems and pressures, it's very clear that it's a real challenge of how to make this program fit in what we often argue for as Scandinavian or European way of building social protection system by introducing universal programs for specific groups. Not for everyone, but for specific groups. In this case, children. We can also talk about the elderly. So it's a question. On the other hand, there is another case, China, where a lot of development partners, a lot of experts are arguing for introduction of universal child allowance. And there are good reasons why in China it will fly and it will make a lot of sense. And again, for political reasons, this is completely blocked at different levels, at the local level, at the provincial level, at the national level. So political environment and societal consensus about such programs play a very important role. And so far, we are seeing cases such as the case of Mongolia, where there is another reason for instituting this program, in this case, sharing the benefits of the natural resources with everyone equally, which enable the movement in this direction. But in many other cases, when there are these complicated fiscal trade-off, political trade-offs, it's really a hard starter. So that's in a nutshell a response to a question. Thank you. Sorry for taking so much time.
Thanks a lot, Ruslan, for this very comprehensive response to the question. When you mentioned societal, how do you pronounce it, consensus? I mean, it reminds me of our social dialogue at the ILO. That is an effective way to build a national consensus around policy reforms. So I think this is very interesting for all the participants to hear that from you as well. And Shara, I would like, I see your hand is up. So do you want to comment? Thank you.
Yeah, thanks very much, Valerie. And I really want to thank all of the speakers. I mean, it has been a really excellent panel. And if I can just ask one more maybe follow-up question to Ruslan. I mean, on this question, I mean, you were very clear about the fact that this kind of universalism of the system is something that, you know, is built over time. It's not something that happens overnight, which of course, you know, I think is a common understanding in among those who work on social protection, that this is a gradual process. There are negotiations and social dialogues, as Valerie was referring to, but also, I mean, I think there's also, I think we need to also be clear that there's what you call politics. I mean, there's a political economy to creating fiscal space. So that is also not a given. It's there's malleability, if you like. There's, you know, it can be negotiated. More resources can be negotiated and allocated to social protection. So how fast or how slow this extension and expansion happens is also, you know, politically determined. And it's not just, you know, yes, of course, it's contextual, but there's also a political economy to how and to what extent resources are allocated to social protection, and how slow or how fast different groups are able to kind of, you know, enjoy the right to social security. So I think that's an important point to emphasize. But my question is really, you spoke very well and very clearly about the need for universalism and different, you know, patterns of creating universal systems. Now, in your view and the bank's view, within the discussion about creating systems, what role do you see for social insurance programs? What role do you see in particular for private and voluntary arrangements? Once we move into the vertical dimension, how do you see these two roles, and where is, you know, the World Bank's advocacy these days? I think it would be really good to hear that. Thank you.
Thank you,
Thank
Shara.
you so much.
Okay.
Thank you for fantastic questions, Saha. This is really a pleasure to be connected with the colleagues and see that we are thinking along the same lines. And I completely agree with your observations. I think that coverage of the informal sector through the innovative forms of contributory systems is basically the future, is how the social protection systems overall can leapfrog in most developing countries to a level of maturity that will be adequate for the ambition of using social protection as a transformative tool. Risk management remains a huge challenge, and it's actually an increasing challenge. We started with Antoine saying how the new world is all exposed to the new challenges. So extending social protection to this group is incredibly important. The real question is really what to prioritize in this, right? Because it's hard to do it everything at once. It looks like we are pushing the countries to do many things at once. We absolutely are clear that extension of health coverage and health insurance coverage is a priority number one, and there is strong international commitment for the universal health coverage. This requires resources because, as we know, a lot of people cannot afford access to the modern healthcare, access to the regular services, to the primary and especially the tertiary. So this expansion and this complex negotiation of what is the boundary and how fast you can go is very resource intensive. And we just heard from the presenter from Rwanda how innovative was their thinking about mobilizing resources for that. I wish in the social assistance we will be as bold and as thinking outside of the box in trying to find the sources of revenue. But you're absolutely right. If there is a political will, it's possible to do. But that competes with another priority of extending old age coverage. It competes with another priority of providing relevant assistance to the poor to ensure their economic inclusion. And those are competing priorities. Unfortunately, it's impossible to combine this into one program that will do everything at once and will be financed from one source. So this is the challenge and this is the complexity. And I'm really glad that Valerie mentioned SPOT, because I think it's really a breakthrough and it's a major innovation in helping us to engage in a structured way with development partners on these difficult questions. Thank you.
Thank you, Ruslan. I see also Alex, who has her hand up, and I hope that Alex will raise a question for our colleagues and friends from Malaysia and Indonesia. Alex, the floor is yours.
Yes, thank you. Thank you, Valerie. Yes, indeed, I have a question for Malaysia. As Ruslan mentioned just now, it can be difficult to find financing for the extension of social insurance. So with that in mind, I would like to ask Malaysia, what was their rationale behind extending social insurance to very specific categories of workers, as they have done in the past few years? It's very clear that there is a big political will in Malaysia for the extension of social insurance to more and more different groups of workers. Some of them often find themselves in the informal economy. So what is the rationale behind that? Why social insurance? And also why opt for mandatory coverage?
Thanks, thanks, Alex. The floor is yours.
Farkani is here.
Yeah.
Okay, cool. So I think there's two parts of the question. One is in particular specific group of workers, right? So I mentioned earlier that the few group of workers were self-employed, and then migrant workers, eventually domestic workers, and then housewives. I think in particular, some of the categories of workers are, I guess, vulnerable, and also there were recent political wills, given the drastic change in the labor market, with especially the gig workers. And you also see the disproportionate effect of COVID-19 on households or on the care economy as well. So I think the political will came actually from the demand and the society itself. So of course, Percaso ride upon that trend to actually sort of impose our model and our system, which is social insurance, a contributory model, to extend our coverage to these people. In particular, of course, the idea is to share that risk. So, I mean, I'm not too sure if everyone would agree, but then the idea is to get the formal workers or the employed workers to actually subsidize some of the risk that is being faced by other more vulnerable workers, like domestic workers, self-employed workers in the informal sector, especially. So that was the, I guess, thinking that you could actually pool the resources under a social insurance model versus something that is more, I guess, on the social assistance basis. The government was very restrictive in actually providing. I think that there wasn't as much political will because they feel that will be a short-term gain for the government. if it's in the insurance model, I mean, social insurance model, there's also a long-term gain. There's also the idea that we'll be providing portability for people, for example, in the care economy to go back into formal workforce, or for people in the informal workforce to go back into the formal workforce. So there was that thinking that we are building upon something that is already existing in the labor market. On the financing part, you mentioned about how do we get financing for some of the vulnerable group. I think I mentioned earlier that we do have matching contributions for selected group of workers. So for example, like certain categories of self-employed, like gig riders, I guess voluntary public sector volunteers, they are given some form of matching grant, so that it comes from the tax base. The idea is actually to promote awareness among this group of workers to contribute on behalf of themselves. And also I mentioned that the burden of contribution then lies with themselves to actually contribute, right? So there's no employer to contribute on behalf of them. There's a bit of a debate, ongoing debate on whether that would add burden on the tax system, and we're subsidizing the informal sector. But we were very clear with government that this is going to be a 5-year gradual plan, that the matching contribution will be gradually reduced over time as we slowly make the voluntary plan to something that is more mandatory. Right now, some of the sectors are already mandatory. What we want to do is eventually to make it more automatic. So the automatic registration comes upon renewal of licenses, for example. We also talk for example, associations. So for fishermen, one thing we're doing is that we use the association to actually get buy-in. So if they want to be part of the association, they should follow some of these criteria to register. So there is some idea about formalizing some of these sectors in the longer term. So there is a short-term move as well as something on a longer term.
Thank you.
I hope I wasn't too broad.
No, it was very interesting. Thank you so much, Mr. Noor. So thanks a lot to all our participants, panelists, and moderator. I think we have, touched upon many important topics on the need for universal social protection, to protect all people against the life cycle risk, and increasingly to protect also all people against the co-virus risk, whether it's an epidemic, the climate change, etc. We had many examples of diversity of approaches and mechanisms to extend social protection coverage to those who are in the informal economy, and also to the poor and vulnerable. And all this debate on voluntary versus automatic versus compulsory affiliation and payment of contributions. We had many inputs on the different ways to finance social protection through contributory, non-contributory, and all the amazing list of innovative financing mechanisms that was shared by Rwanda. We had the confirmation, of course, that social protection needs to be embedded in law to be sustainable, and also to ensure that everybody understands its rights and its responsibilities. We had a number of mentions of the importance of building a consensus across society to make the priority, to make decisions based on the priority of the people, based on social dialogue. Building this consensus is very important to move forward. We had also a lot of testimonies of the importance of linking social protection with other development policies related to the formalization of the economy, the development of sustainable enterprises, the creation of decent jobs. And this leads me very naturally, actually, to this idea of this initiative of a global accelerator on jobs and social protection for just transitions that was launched by the UN Secretary General Antonio Guterres 1 year ago, and which really aims at ensuring that on the social protection front, that all countries participating in the accelerator can really achieve universal social protection by linking social protection with other policies. And here, for instance, a country like Senegal, there's a lot of discussions on how to formalize the economy, and by exploring new financing source for social protection to increase really the investment in social protection that the country need to make to achieve universal social protection. So linking both this financing debate to also the development of coherent and comprehensive social protection and other policies to facilitate really the achievement of universal social protection. And last but not least, I think the discussion could continue among ourselves in future events of the OECD, of course, but also as part of the partnership on universal social protection that is co-chaired by the ILO and the World Bank, but includes many, many countries. So if your country is not yet part of USP 2030, I think it could be a good opportunity to join shortly, so that we can continue to be part of the same platform and continue these discussions. So thanks a lot again for all your inputs for this lively and very interesting moment together. And I think I will give now pass the floor on to the organizers so that they can explain what's going on after this session. Thank you.
Thank you very much, Valérie, and thank you to all speakers for these lively discussions. In the next session, we will discuss how social protection can allow individuals to sustainably escape poverty. We'll have interventions from Argentina, Brazil, the Republic of Korea, as well as two leading NGOs, BRAC and Give Directly, as well as our friends at the International Labour Organization. So very much looking forward to seeing you back in 10 minutes at 2:45 p.m. Paris time. Thank you.
Thank you.
Thank you.
Thank you.
Hello again, bonjour à tous, and welcome to our great panel of speakers. Now we go to our last session on social protection, jobs, and sustainable livelihoods. It will be moderated by my colleague Juan Vázquez Zamora, Deputy Head of Unit at Latin America and Caribbean Unit at the OECD Development Center. Juan, over to you.
Okay, thank you very much, Antoine, and welcome to all. It is a real pleasure to be here with you, moderating this panel representing the Latin America and the Caribbean team at the OECD Development Center. I will not want to take up much of your time. We have a very rich.
Juan, I'm really sorry to stop you. I'm afraid we don't hear you very well. Could you speak a little louder?
Okay, I'm speaking loud, so this might be a problem with the computer, but I will get closer. Can you hear me now?
Can you hear better?
Okay, I don't know what to do then because I'm really next to the screen now.
Can he increase the volume?
Can you hear me?
All right, let's. I think it's okay.
Okay, well, I will go on and I will try to speak as loud as possible. Well, I will try. I was saying I will not try to take up much of your time, particularly if you cannot hear me well. There's no point on speaking too much. I will just try to moderate this session. But as you have seen in the agenda, the idea is to understand how social protection programs can have a sustainable impact in terms of jobs and livelihoods, and how, to this end, it is important to integrate social protection policies with other policy areas, for instance, labor market policies. Let me just share a couple of quick thoughts from the Latin America and the Caribbean region, which is my area of work. Just the first thought, which is that, as you know, and as in other developing regions, it is a continent where we have high and persistent levels of informality. And in the context of the pandemic, we have seen innovative ways to make social protection reach these informal workers. We actually heard in the session before the idea that we cannot do everything at once. And particularly in a context of low fiscal space, this is why targeting is essential in our view. And when we speak about targeting, we think that understanding how households are composed and what members of the households are informal, it's a very relevant piece of information. And in this sense, let me just share with you that we have been working together with the social protection team of the Development Center on a database on informality, where we look precisely at the household composition in Latin America and in different regions to understand how many households have all their members in informality. And just to share with you a figure, in the case of Latin America, 45% of households have all members working in informality, which of course has implications for the design of social protection programs and policies. And soon, by the way, we will be publishing a report precisely on these issues, also together with the social protection team at the Development Center. The second very quick thought is on the complementarity of these policies, social protection policies, with other areas of the policy mix, with production transformation, with skills, and of course, the idea on how can we leverage and embrace the green transition and the digital transformation as drivers of better jobs and better social protection. On that, just to share with you that we recently published our Latin American Economic Outlook 2022, just a few weeks ago. And there we devote particular attention to the potential of the green transition for the creation of formal jobs in Latin America and the Caribbean. In particularly, we estimate a creation of 13.5% of net jobs in the region in sectors particularly like agriculture or transport. So let me, with this, go on with the agenda. We have a distinguished panel with us. We have 3 countries, Brazil, Korea, and Argentina, represented around the table. We also have 3 discussants from BRAC, Give Directly, and ILO. And just 2 quick housekeeping issues before I give the floor to them. Many of you were in the previous session, so you probably already know that you have interpretation, and also that the chat, unless I am not wrong, is activated. And in the question and answer session at the end, feel free to either use the chat or just raise your hand if you want to participate. So with this, let me move on to our first panelist. He is Marcelo Alvarez de Souza. He is a specialized technical advisor at the Benefits Department of the National Secretariat for Citizenship Income in Brazil. So Marcelo, please, the floor is yours.
Bonjour, hello. It's a great pleasure to be here with you. Thanks for the invitation. Well, let's talk about the Brazilian experience in social cash transfer program, the Programa Auxílio Brasil, Brazil Aid. Well, it's a federal government in partnership with municipalities and subnational governments. We have in Brazil 5,500 municipalities and 27 subnational governments. The federal government made the financial, municipalities do the interaction, direct interaction with the beneficiaries, and the subnational governments, they made the coordination with the municipalities in the territories. The federal program was created in 2003, almost 20 years ago, and was it was known by the time as Programa Bolsa Família. The program integrates several public policies with a special emphasis in social assistance. That is the axis of the program in the interaction with the beneficiaries. And so with the health and education dimensions also. The program is aimed at families in extreme poverty. We understand extreme poverty per capita income until $21, and also for families in poverty. We understand poverty as an income between $21 and $42 per capita. Each family receives at least $120 per month. The program has 21 million families as beneficiaries. It equals 55 million people as beneficiaries. The financial side is $2.6 billion per month, or $21.2 billion per year. I will just emphasize the question about conditionalities, because the cash transfer, the beneficiaries has some obligations to receive the cash transfer. In particular, health obligations, vaccination, nutritional monitoring of children under 7 years, and prenatal care for pregnant women, and education, some minimal monthly school attendance by 6% for children aged 4 and 5, and 75% for children between 6 and 17. And that's it. Well, the program is a little old. We have some research that were made to evaluate the program. We make insights about your execution. I would select 3 studies, 2 studies from the World Bank, one about the duration of stay in Bolsa Família and determining factors, the second about the profile of working people between the beneficiaries of Programa Auxílio Brasil, and one study from a Brazilian think tank named Instituto Mobilidade e Desenvolvimento Social, Institute Mobility and Social Development. The results são très interessantes. We have noted that the cash transfer are important to eradicate the extreme poverty. Between 2012 and 2019, the families of the Programa Bolsa Família, Auxílio Brasil, remained on average 5 years in the program. In this period, 49% of the families leave the program after 7 years. They did come back. Between 2005 2019, 64% of the children and adolescents between 7 and 16 years old leave the program. But in this case, in this study particularly, we don't know if these children made unsustainable exit without comeback, or a precarious exit with one or more comebacks. Well, we can say that the cash transfer is very important to eradicate the extreme poverty, but they are enough to do it alone. Between 2012 to 2019, 39% of the families remain in the program, and 12% come back answer twice. Well, it totally 51%, half percent of the families of the program. And we can see too that between 2005 to 2019, 36% of the children and adolescents remain in the program. Well, we have at least one tier or half of the people who are beneficiaries of the program that stay in the program. They did not remain. They remain. They did not leave the program. We can understand it because the beneficiaries of the program, they are poor workers. 77% of the men and 41% of the women who are beneficiaries, they work. 40% are informal employees. The Brazilian national average is 21%. 32% are informal self-employed. Brazilian national average is 19%. 10% are formal workers, formal employees. The national average is 39%. And 7% of the beneficiaries are formal self-employed. It's the same, the national average. Well, in conclusion, we can say that the cash transfers are important to eradicate extreme poverty, but they are enough to do it alone because the beneficiaries are poor workers. And we can think that the extreme poverty is a process of in and out over time. The social trajectories of the poor in Brazil are very precarious. They can leave the program, they can leave the extreme poverty, but in half of the case, the trajectory is not sustainable because people tend to return to the program, return to the extreme poverty level. And one important conclusion to us too is that we need to connect the poor to opportunities that doesn't exist in their networks. They are poor because they have poor research, poor networks. It's important to expand the networks to the poor people who have access to another opportunities. Thank you very much. Merci beaucoup.
Thank you very much, Marcelo. I hope you can all now hear me better. I moved to another room, so I think it's working much better. I didn't hear everything that you say, Marcelo, because I was moving to this room, but I got your last messages, which were really clear on part of the successes of this program in Brazil, but also the importance of complementing these efforts with other policies, with access to networks, etc. So that was very interesting to hear. We will have time to follow up later with questions from the audience. But let me now then move to Professor Lee, who is a research fellow at the Employment Information Service in the Ministry of Employment and Labor in the Republic of Korea. So please, Professor Lee, the floor is yours.
I'll show my presentation file. Do you? Okay. I would like to talk about the linking employment and social protection program in Korea. With delivery channel connecting social protection and employment jobs, we set up the—
Professor, just sorry to interrupt you, but at least here we cannot see your screen, or we are not seeing a presentation. Would you mind trying again to share it? Now we do. I don't know if that's the first slide. It says Employment and Welfare Plus Centers. Is that the first slide of your presentation?
Can you hear us, Professor? We are not hearing you. We see a slide now, but we cannot hear you. I don't know if you're muted.
He's muted.
It's funny. Okay, I'll try again. All right.
Okay, now we hear you and we see the presentation, so it should be fine. Thank you.
Okay, sorry for things. So we set up the organizational preparation for connecting employment and welfare because people are far away from the labor market, often have multiple the host turned off all the speakers, so I lost my mic. Can you hear me? Yeah.
Presentation.
I'm not.
We hear you, and we don't see the presentation. But if you want to
Right,
go on without presentation, it's fine. We can listen to your thoughts.
I'll just talk. Yes, because the host keep. It's not me, but your host keep turning off my shared presentation. Also turn off the speakers. Anyway, so to connect these welfare people to more closely with to the labor market, we set up the Employment or Welfare Plus Center. So that the title itself says employment from the Ministry of Employment and Labor and connecting to the welfare from social municipal office, and plus means many partners in the local area, such as MPOs, are participating together. Also, plus means like a credit union, because the people outside of the labor market often have a problem with poverty, credit issues, housing, and sometimes, most of the times, they are sick so that they cannot work. So we set up this organizational program to working all of these partners in the job center together. We invite these outside partners, municipal office, into the job center, make a bigger job center. So in Korea, there are 102 employment welfare plus center and working 6,000 staff, and around 800 staffs are from partner organizations. Okay, and also to support this big size working welfare, connecting welfare and employment center started since 2014. So it's been almost 8 years now. And then to support this program, we set up the institutional setup called National Employment Support Program, which is Korean style unemployment assistance program. Someone who we working together people on the social protection side, and we realize there are many people are outside basic social protection, which is first tier of social protection, and then also unemployment insurance in Korea. In between, there is a big gap. We found out that someone outside of a social basic protection, and also some people outside of unemployment insurance. So we set up from last year, January, so-called National Employment Support System. People will receive around $300 per month for assistance benefit, and then participate many complicated one-on-one case management program. With this assistance, and people are participating around the 6 months of a program in the Employment Welfare Plus Center to support those people to employment. This program was started in 2009, which at that time we call job success package. These are the people outside of unemployment insurance came into the job center and received these case management services. For the last, since 2009 to 2020, there were around 2 million people participate in this program. And last year, we expanded this program to NESP program and give some sort of unemployment assistance. And then for the last year alone, we released around 400,000 people will participate in this program. So there are two shakes. One, first of all, organizational setup, which is Employment Welfare Plus Center. And then institutional setup is a National Employment Service Program. So with this kind of setup, we try to combine employment and social protection in one place with one program. And so far, it seems a bit successful. Thank you very much.
Thank you very much, Professor. That was very clear, even without the presentation. And it's a very interesting example of this combination precisely of the social protection programs and how to connect it to labor market policies and labor market unemployment insurance. So also the scale of the program, you mentioned 2 million people that have participated in it, which is very interesting, and another 400,000 that, if I understood well, will be participating soon in this program, or are participating now.
Last year.
Last year. Okay. Well, then, yeah, just a point to highlight the scale of the program, because sometimes we speak about programs that are not that big. So this is a very important point you made. So yeah, thank you for this. And with that, let me then move on to the next speaker, who is Eduardo Lepore. He is the National Director of Coordination of Social Security Regimes at the Ministry of Labor, Employment and Social Security in Argentina. So Eduardo, thank you for being with us, and the floor is yours.
Good morning. Many thanks, Juan and Antoine. It's a pleasure for me to share with you and the rest of the speakers and discussants in this session that we have a big question around these themes. Particularly, I'm going to talk about an employment policy recently established by Argentina. And this policy is named Puente al Empleo in Spanish, Bridge to Employment, and is a new national program that is implemented by the Ministry of Work, Employment and Social Security and the Ministry of Social Development from Argentina. Basically, the program seeks to promote the labor activation and the access to formal employment for social assistances beneficiaries of working age. We are in poverty and often working in the informal economy. The focus on people excluded from the formal labor markets who are at the same time beneficiaries of the social assistance is one of the most important differences in terms of design with other policies applied in recent years with similar objectives. Also, I think that it's important to point out that the design of the programs, especially the economic incentives it's offered, is the result of the public policy experience accumulated during the pandemic time and the socioeconomic emergency measures adopted in such a context to preserve incomes and employment. In this sense, we can say that Puente al Empleo is a practical attempt to achieve two transitions: the transition from informal to formal employment and the transition from non-contributory to contributory social protection schemes. While the management of the social assistance programs is basically the responsibility of the Ministry of Social Development, the implementation of the active labor policies and the organization of the employment services is the primary responsibility of the Ministry of Work, Employment and Social Security. As a part of the social and institutional background that explains the public decision to formulate Puente al Empleo, I should say that before the pandemic, in a context of economic recession and later as a consequence of loss of incomes related to the pandemic, the coverage of social assistance had a strong expansion in Argentina. Today, the main social and employment program aimed at providing income assistance to people of working age, whether unemployed or employed in the formal economy, reached more than 1 million beneficiaries in the country. This number represents a quarter of all formal jobs in the private sector. Besides, we should also bear in mind that these social assistance schemes, despite its size, is not formulated on the basis of the universality and therefore cannot be equated to a basic income policy. In fact, according to the official statistics, approximately 4 million people are employed in formal jobs and approximately 2 million are unemployed. For this reason, Puente al Empleo establishes economic incentives for the demand of labor, specifically designed for the hiring of informal workers who are beneficiaries of social assistance schemes. The incentives for the employer who decide to employ these workers mainly consist in the temporary reduction of contributions and a subsidy for the payment of salaries. The reduction of contribution has a term of 12 months since the hiring of a beneficiary of social assistance and suppose the full exoneration of the employer contributions, excluding the contribution related to the health and work accident insurance. Regarding the salary subsidy, the Ministry of Social Development maintains the payment of the social assistance benefits to the beneficiary hired through the program during the first 12 months of the labor relationship. The amount of the social benefit is equivalent to half the legal minimum wage. Thus, the employer can take into account for the payment of the salary, which corresponded to the collective agreement, the sum of money that the worker received directly as a cash transfer of social assistance. This means that the employer must pay the difference between the salary established according to the collective agreement that applies and the amount of the social benefit. Another point to highlight is that in order to encourage the use of the incentives offered by the program allows hiring in the different legally regulated labor modalities. This implies that the employer can take the benefits described not only for full-time and permanent jobs, but also for part-time and temporary jobs. The previous measures put into practice with the intention of promoting labor registration only allowed hiring permanent positions. However, Puente al Empleo stipulates that it's a condition to access the benefits for the employer that the hiring means a new jobs and that these new jobs suppose a net increase in the number of workers in the enterprise. This is a condition to prevent the abuse of the benefits granted and the turnover of the workers. Finally, the program also includes some economic incentives for the workers. Here, they are a key point because we have to achieve the activation and labor registration. And given the current level of social assistance protection, it's important that the benefits provided by the family allowances contributory schemes imply a significant improvement in family incomes, especially for workers with a low level of qualifications. we have to consider that a large proportion of formal workers in the lower segment of the labor market earn salaries that are not enough to overcome the household poverty. Therefore, if the benefits of the contributory family allowances are not more generous than the non-contributory benefits, the monetary situations may not improve even after getting a formal job. So, in summary, Puente al Empleo is an important step in the direction of establishing a policy framework for the activation of people excluded from the formal labor market in a context of important advances in the establishment of minimum floor of social protection for people in working age. Coordination between the contributory and non-contributory mechanisms of the social protection system is a crucial challenge to achieve this goal. Many thanks.
All right. Thank you very much, Eduardo. You hear me? Oh, okay, we are okay. No, it's a very interesting example also from Argentina for many reasons. First, for the institutional cooperation that this involves across ministries and across the contributory and the non-contributory system, as you just mentioned. I very much like the idea the way you put it and the way you frame it, when you speak about two transitions from informal to formal, from non-contributory to contributory social protection schemes. And it's very interesting, of course, the emphasis that you put on the demand side and the toolbox of incentives and measures to support employers in promoting formalization of people that are excluded of the formal sector. So that was very interesting. Again, I'm sure we can follow up with more details in the discussion, but as a first summary of the impact and the design of the program, that was very illuminating. Okay, well, so with this, we come to an end on this first part of the session, where we have heard thoughts and examples from Brazil, from Korea, and from Argentina. Let me now move on to the next part of the session, where I will invite the discussants to provide their thoughts on these programs, but also other ideas that they would like to share with us. I would like to start with Mr. Gregory Chen, who is the Managing Director of the Ultra Poor Graduation Initiative at BRAC. Mr. Chen, the floor is yours.
So thank you for the invitation to join you here today. We're, first of all, delighted to see that including some discussion of sort of productive livelihoods and linking that to social protection is part of the discussion here today. And I'll give a little bit of background on BRAC itself, because our connections to social protection and the work that we've done historically in Bangladesh go back to the 1970s. And so I do want to draw those links because I think it's relevant to this audience today. But I want to talk, the main point of the discussion is for us is to share with you an approach that we've developed originally in Bangladesh called the graduation approach, which was intended, bearing in mind the context of Bangladesh, which was a highly informal agricultural society 50 years ago and still is heavily informal. We've benefited in Bangladesh from growth that's averaged about 6% for the last 20 or so years, although recently hit a trouble spot like many places. So this approach was developed in a context of a very underdeveloped society that was going through a rapid economic transformation over the 50 years since its independence. And BRAC has been operating in Bangladesh over the course of those 50 years. Graduation is an approach we came to after testing. I'd say BRAC has tested we've failed at many things. Let me put it that way. We have tested and tried many, many things across the 50 years in Bangladesh. Graduation came to us in the 90s when we were discovering that many poor people were benefiting from growth, but there was a hardcore group of people who were being left out. And so this was a package, an intensive package, what we would classify, along with Give Directly, I hope, what we would classify as a big push, a specifically targeted package, time-bound investment that lasts about 24 plus months, that puts people on a sustainable path to livelihoods, meets their basic needs, and allows them to grow themselves up and out of poverty. It doesn't move them into the formal system, as our other speakers have suggested necessarily, but the Bangladesh economy is not heavily a formalized economy. It's still a heavily informal economy, despite its rapid growth in recent years. And I would say, quite apart from Bangladesh itself, the rates of poverty and extreme poverty have dropped dramatically in Bangladesh's 50 years. The graduation approach is something we developed about 20 years ago and have been implementing it in Bangladesh for the last 20 years. I won't bore you with all the details of our own direct implementation, but we've put 2.2 million people through the program in Bangladesh itself. What I would like to share with you is that this has been one of the most heavily evaluated programs. And what we see is that because the investment is time limited, that the returns on investment are over a longer period of time. And by that, we now have evidence that is 7 or 10 years in length, are 3 to 4 multiples measured in terms of consumption of the household of what the original investment by the government or the donor was. For successful and well-run programs. So I'm not going to go too much more into all the details of all of that. If people want to find it, there's extensive literature on the graduation approach. What I would like to share with you today is that we are now working ourselves in 8 countries and directly with governments. So not so much focused on our own implementation, but working with a whole range of social ministries and rural development agencies across the world to help converge some of the learnings out of the graduation approach with other social protection systems that already exist in multiple countries. And particularly so that these programs can reach excluded and the people in the most extreme forms of poverty. Let me mention to you a few countries where we're working. And you know, there's more than this, but Philippines with the Department of Social Welfare and Development. There's South Africa needs to reform its very large SASA social assistance program. Very few people are moving off to sustainable livelihoods in that program. In India, and I'd love to hear from Give Directly, but India is one of the largest cash delivery markets in the world, what they call direct benefit transfer. $34 billion in cash transfers in India every year. At the same time, India has what they call the rural livelihood missions, which are large state-run programs that invest in rural areas and rural livelihoods. And one of the largest graduation programs is run by the state of Bihar, 140,000 households today, investments coming straight out of the state budget. The other countries would be Ethiopia, where, and again, to the theme of this event, there's a very large World Bank supported productive social safety nets program, reaching historically 700,000 households across Ethiopia. So I'm just giving you a flavor of the kind of institutions and other forms of government services that we are hoping to work with and scale up this approach. And delighted that, that the underlying livelihoods and productivity is being connected now with the broader social safety nets program, which, and just to reflect back on the history in Bangladesh, while we are an independent NGO that runs a whole range of commercial and less commercial and fully subsidized programs, we have always connected into the government what little social protection there was in Bangladesh historically. We've always connected into that. So the original antecedents for this program come out of a link to a food security program where people were getting their basic nutritional needs met through a government program. It goes back to original food for work programs that the government was trying to get rural and landless laborers into sort of basic wage income. And we've built these programs around those social protections that were available in Bangladesh. Even today, when we go into an extreme poor household in Bangladesh, if the woman in that household is above a certain age and qualifies, most of our efforts are actually to shift her and make sure she gets her entitlements in the old age scheme in Bangladesh, which is available for women and men over a certain age. So there's long been a connection between our programs and this broader social protection field. So let me stop there. Thank you for the chance to share this with you.
Thank you very much, Gregory. This was very, very interesting to hear. Also, because you gave us the historical background of your work. That's very interesting. Also, a panoramic view of the countries where you are working and how your work has evolved into something more sophisticated. And also for the reflection on the evaluation of your programs. It has been well evaluated, and the long-lasting effects. It's something that's very interesting to hear, and something that we wanted to have as part of this discussion. Again, I'm sure we'll have the chance to hear more from you in the questions and answer session, but let me for now move on to the next speaker, to another approach to this problematic, which will be given by Michael Fay, who is the executive chair and co-founder of Give Directly. So Mr. Fay, thank you very much again for being with us. And we are happy to listen your thoughts. The floor is yours.
Thank you so much for having me. I think this is very exciting. Many of the previous speakers and are many of my heroes. Give Directly was very much inspired by the early work in Brazil and Mexico at the time that I was doing a PhD. And BRAC remains one of the organizations most committed to evidence and long-term evidence in the field. So I am amongst heroes, and I'm only sorry that I'm not there in person with you. There is so much to respond to and talk about, and we could do that for hours. But with the 7 minutes I have, I wanted to focus on two things in terms of not what we do, but how we do it and the operations. Because I think that often we get caught up in debates on what intervention we should be implementing. And so much of that is actually the operations. Two organizations may run a specific program in very different ways with very different outcomes. So the two subtopics I was going to talk about briefly, one is research and the second is technology. And rather than go holistic, for which we don't have time, I'll spend some time talking about one specific program we did in Togo on the technology side and specific work in Rwanda on the research side. So let me see if the screen share happens to work for me. Can folks see this? Excellent. And let me see if I can do it as a slideshow. So let me just give you a quick overview of the challenge. So this was during the time of COVID, when a lot of traditional operations were rendered impossible because we couldn't go door to door in the household. And the government of Togo wanted to scale a COVID response nationally, and they wanted to do so in an extremely tight time period. So traditional operations were very much outside the window of possibility. So what we did there was really digitize the end-to-end process. Now, traditionally with Give Directly, we have done digital payments. So we have leveraged mobile money to be able to reach people more securely and more quickly than had previously been possible. But what the Togo government did as well, in partnership with us, was actually move the targeting mechanism to digital. So traditionally, with a lot of programs, including Give Directly, we will go door to door. We will conduct a household survey. we will do a proxy means test, and then we will enroll people that fall below a certain threshold. We didn't have time for that, and we also couldn't do that because of COVID. So what we did was partner with the mobile telcos and the government to obtain phone data with permission of folks. Once we had that phone data, we were able to train algorithms, and specifically AI, to identify the poorest people that would have been eligible at a national scale. And just to give you some intuition, if someone is sending money or receiving money from Europe frequently, or calling Europe frequently, they're probably not the poorest of the poor. So we use these AI algorithms to pick the folks that would receive cash. We then built a tool where individuals could self-enroll on their feature phone. They would type in a short code, *855, and there would be some verification checks. And once they had enrolled, they would receive money instantly on their phone. So the program wound up being called Novici in Togo, and then InstaPay as we've been scaling it more broadly. So this is pretty remarkable when you think about it, because what it meant, if I just go quickly to this slide, was we were able to enroll tens of thousands of people in days, and we could have done more. It's an infinitely scalable and instant program that not only could be used for this sort of social protection, but is something that we are now rolling out in humanitarian contexts. To just imagine the image, there's an earthquake, Nepal, we know who's affected within a region. Once we know that, and once we have the funds, you could instantly pay those folks affected. Now, of course, you're not going to reach everybody. Togo happens to have a very high mobile penetration rate. So you have to go with some boots on the ground to find those that didn't have access to a phone. But the scale at which you can operate and the speed at which you can operate is quite remarkable. I'll skip some of the details of all the lessons of how we did it with radio campaigns and virality. Show you 2 slides to just give you a sense of the complexity. So behind all of this is a ton of technology. There's an entire system that needed to be built that included everything from these AI algorithms to payment integrations with the various telcos to a recipient management platform that moved recipients through their various stages and so forth. And what Novicia showed us, which is not surprising, is that the transition from humanitarian to development is one that we should really think seriously about, because humanitarian crises often offer us the opportunity to put in place the technology by which we can then later run longer term social protection programs. It creates a window to build this technology and to deploy it as quickly as possible. So that was the technology example of Togo, of what's possible at scale and instantly. With the few minutes I have left, I'll just talk about the research aspect. Most of us on this call are convinced of graduation of social protection of cash. 2 things that I would think about as we do our programs. One is what's needed to convince those that are less persuaded and how we do that. So I had the luxury of being persuaded by Brazil and Mexico, I guess 2 decades ago at this point. But we are now doing programs that actually run randomized evaluations of social protection and cash programs against other development interventions. So what that looks like is you say, if we're going to spend $500 per household, we can try intervention A that costs $500 per household and intervention B, which costs $500 a household. And let's look at that comparison directly and use cash as a benchmark to understand what is the threshold that we need other interventions to cross. So we've done this in Rwanda, we've done this other places, and I think it's been a powerful example as we have conversations with the broader community. The second piece of research that I'd encourage us to think about is what form of cash and how to implement it. People often talk about cash as a monolithic thing, but even within Give Directly, we have dozens of different types of programs. We've done large cash transfers. We've done small cash transfers. We've done cash for 12 years. We've done cash for 1 year. We've done cash targeted at urban areas. We've done cash targeted at those with tuberculosis. We've done cash in partnership with folks doing training programs, and we've done cash alone. So how do these different programs vary in their impact? How does labeling a program matter? How does combining it with other things impact the outcomes? So as we're doing these programs, it really is an opportunity to learn, not just whether cash works, which I think is now well established, but how the design and the implementation of the cash program impacts the outcomes. So I'll pause there and just end where I started, which is thank you for having me. I think many of the folks around the table have contributed so much to my personal thinking and Give Directly's thinking. So just really excited to be here with all of you.
Thank you very much, Michael. Those were very interesting examples. I was particularly amazed by the use of digital technologies that you made in the example that you shared in Togo, how you reached in a very short time many people, how this can be scaled up and used for other interventions. That was very interesting. Of course, you raised a very important issue, which is the digital gaps and the low mobile penetration that we see in certain areas, probably in those areas that are in most need of these interventions. But again, that's part of the improvements that we need to discuss and understand how to reach those people. But in any case, that was fascinating. Thank you very much for the very interesting example. And with that, I think we can move on to our last discussant. She is Christina Berendt, who is the head of the Social Policy Unit at ILO. So Christina, I think you are there with us. Thank you also again for this, and the floor is yours.
Yes, thank you very much, Juan, and good morning, good afternoon, and good evening to everyone here. And I must say, I'm really fascinated by the very kind of richness of this session and the different experiences and very key reflections that have been shared with us from Argentina, Brazil, and Korea, but also from my two co-discussants from BRAC and Give Directly. And I think given the focus of this panel, which is really focusing on how social protection programs can be better integrated with employment and broader economic social policies, I think it's really important to look at these issues in conjunction, and also look in particular on how they can be better integrated with employment and broader economic policies in order to ensure decent work and sustainable livelihoods in the longer term. And I think we have heard that very interesting experiences both in this panel but also in the previous panels. And I think this is really critical to aim not just at reducing poverty and vulnerability, but really to be more ambitious and actually think about how to prevent it, which is critical to protecting and promoting people's rights and dignity, but also to ensure sustainable and equitable economic and social development. And in that context, let me just share some reflections on these very important country experiences. And I think I would like to start with one of the points that Eduardo has mentioned about kind of this idea of a bridge between kind of social protection and employment, a bridge to employment. And I think we have heard from Korea and Argentina very interesting integrated approaches, and also from Brazil on the Bolsa Familia program, also to see how the program has also been linking up with services of different kinds. And I think also from what we heard from BRAC and Give Directly with regard to the synergies and the benefits also of working with governments to enhance the support to vulnerable populations and harness innovations in delivery mechanisms. And I think it's interesting also to see how these approaches can be built into kind of a universal social protection system. But now, talking about building bridges, the question is a bit, where to are we actually building those bridges? And we know that there are a lot of challenges in many countries when we think about the question of to what extent labor markets are actually able to absorb the demand for employment, and especially if we think about the way how labor markets are actually to provide decent employment and also formal employment, because I think this is really two sides of the same coin. And in terms of formal employment, I'm not just talking about work, wage workers with an employer, but I think it's also a question of how to ensure decent self-employment. And I think this is really one of the challenges that we have to face, where we know that many of those who are working as self-employed workers are really struggling with very high levels of vulnerability and also very low levels of productivity. So I think this is also something where we need to find better answers. And I think social protection can really play a very key role in getting over this kind of vicious circle of high vulnerability and the lack of social protection for those in the informal economy. But extending social protection can be really a key input that can transform this vicious cycle into a kind of a virtuous cycle, in the sense that workers will have lower levels of vulnerability, which will allow them to also reach higher levels of productivity, which contributes to more decent employment. And I think this is a kind of a very key in the process of how we think about also of the formalization of employment and also the formalization of enterprises, which is a key part of that, which eventually also can contribute to greater fiscal capacities. And I think this is a very critical point also in the why, how, and I think this was raised also in the presentation on Brazil. So the question of to what extent are these exits from poverty actually sustainable? And to what extent are social protection systems really able to protect people from slipping back into poverty? And thinking about the way how social protection systems can really provide the kind of social protection that is needed for workers all the time. And this is not necessarily kind of the same type of social protection. It's not necessarily the same type of social assistance programs, but we also need to think about how to build up other mechanisms that can really ensure that workers are protected all the time. They might not necessarily need to receive benefits all the time, but they need to be protected all the time. And I think this is really key when we talk about universal social protection and really ensuring that. And I'm just also in terms of, I was talking about this kind of virtuous cycle, and just maybe giving one example of how that can be achieved. And we know that many countries, for example, who have invested in the care economy, improving working conditions of workers in the care economy, this contributes not only to improving the situation of those workers and also their families, obviously, and obviously a lot of them are women, but it also, these investments into care services and decent and quality care services also supports the employment of people in other sectors with family responsibilities, be it childcare, but also increasingly we're talking more and more about long-term care. So I think this is really one of the examples where such investment can really put in place such a virtuous cycle. And I'm realizing that I'm running out of time. But I think, and talking about these mechanisms of really using social protection to kickstart those vicious cycles, virtuous cycles, sorry, is really essential. And I think thinking about how both non-contributory mechanisms, but also social insurance, and I think increasingly also we're thinking about integrated mechanisms that really look into how to bring people, even with limited contributory capacities, into inclusive social insurance schemes is an important part of that story. And just a last word, and I think Valérie has highlighted that also in the last session. But I think one of the key areas where the global community is currently working is the global accelerator on jobs and social protection for just transitions, and looking at just transitions not just from a climate point of view, but also supporting transitions from the informal to the formal economy in the way that really responds to people's needs, which really is also an important part of ensuring decent work and social justice. And I think with that, I'm handing back to you, Juan. So many thanks for that.
Thank you, Cristina. That was very interesting. You covered many different issues, and that's much appreciated. I think in particular, there's something I really liked when you put the emphasis on the demand side and how labor markets are going to be able to absorb that supply, no? And that brings us to a broader focus of the discussion and how we connect these social protection interventions and programs with more broader production transformation policies. And it also connects, or at least that's what I was thinking while I was listening to you, with how we embrace and make the most of the global transformations that we are living through these days, mainly the digital transformation and the green transition, which of course have many or present many challenges in terms of social protection, but are also, we hope, an opportunity to improve jobs and to provide better social protection. Well, that was just a general reflection, but now let me go back to the audience to hear from you, to give you an opportunity to ask questions to the panelists or to make other interventions. Of course, if any of the panelists or any of the discussions want to come back to any, or want to follow up with any of these of comments to the interventions from other panelists, we are happy to hear from you. But if not, if anyone wants to submit a question in the chat or wants to raise the hand, then we are happy to hear from you.
One question in the chat. I sent it to you.
Okay, so we have one question in the chat. Just 1 second. Okay, so this is a question for Michael Fay. And the question is the following, Michael. Has Give directly explored cash plus interventions, linking cash transfers to health, education, livelihoods, or other related interventions in its work with governments or otherwise? Thank you.
We have. So 2 examples. One was a specifically targeted program, I think in conjunction with PIH, to target people that were taking drugs for tuberculosis. I think nutritional status has a big impact on how effective those drugs are. So if folks were getting the cash, the drugs appear to be more effective. So that was one. Another one was actually in the urban part of Nairobi, where we partnered with an organization that was doing skills and training via an app that was working. And there are many more of these examples. I think Cash Plus is an exciting place to explore. I think a lot of the pluses aren't going to be things that Give directly has particular skills out, but it's a great place for us to be collaborating with others.
Thank you, Michael, for that answer. I have here another question, which I guess it's open. If anyone can answer this, but the question is the following: can interventions linking social protection and employment really yield sustainable positive outcomes on income security if they are not tied to the formalization of enterprises and jobs? I don't know if any of our representatives from countries or our representative from BRAC would like to address this question, which is a very interesting one.
I mean, the short answer is yes, in that the as I said, Bangladesh is a heavily informal economy. I mean, more and more there is formal employment, but many of those informal systems are fantastic livelihoods for people, even if they're not formally part of the a formal social protection system or formalized businesses. So Bangladesh's 20% growth, 6% growth for 20 years has been largely built off of family-based enterprises and exporting labor to the Middle East and to some extent now to a large extent into the ready-made garments business. So it's been a mix of formal and informal family-based enterprises.
Thank you. Thank you for this very specific answer. Okay, so we also have one hand raised by Alexandre Kolev, who is the head of the social cohesion unit here at the OECD Development Center. So Alex, please, the floor is yours.
Thanks, Juan. I have actually two sets of questions. One is for Marcelo and Eduardo, based actually on the sort of the wealth of experience that Brazil and Argentina had in terms of, conditional cash transfers. As you know, I mean, there is also a discussion about the impact of unconditional cash transfer. And there seems that there is recent evidence that shows actually that unconditional cash transfer may also have some positive impacts on nutrition, on health, behavior, and so on, while actually not putting too much pressure in terms of the pressure that the beneficiaries may have to comply when there is conditional cash transfer. So I was wondering, from the experience of Brazil and Argentina, what is the state of the discussion on those issues, conditional versus unconditional cash transfer, given that we see that actually in the context of unconditional cash transfer, we see some positive outcomes, maybe not to the extent of conditional cash transfer, but still, and there is also some cost benefits arguments in terms of also of releasing the pressure on beneficiaries that have to comply, and this might be particularly challenging, especially for women who usually have to do the work. So this is a question for Brazil and Argentina, and one question to Michael on Give Directly. I mean, you had mentioned the results of various impact evaluation that you have been conducting, looking at different modalities of delivering cash. My question to you is based on the accumulation of evidence from this impact evaluation. Are you actually coming with some kind of generalizations of what works and what are the ways you need to deliver cash that may have the greatest impact, or is it that actually you see that it varies a lot from one place to the other? Thank you.
Should I start on that and work from the back? I'm happy to go either way. All right, I'll just hop in. Alexandra, that's one of the hardest questions to answer, so let me try to be brief. On the operations side, I think there are a lot of lessons that you'd want to apply pretty universally. So a real obsession on fraud and having a separate independent team to audit the targeting criteria and the payments, I think is a lesson that we've had. On the technology, making sure that you can actually have an indestructible record of changes made. So it is very easy for an employee or someone to go in and change a bunch of phone numbers to their family phone numbers or someone else. So there are a lot of operational lessons, and I'm happy to connect offline on what those are, and I'd say those are pretty universal. On the research lessons, it's an impossible question to answer for the following reason. It depends on what the donor wants to achieve. And I'll give you the most simple of examples. What we have seen is that if you target slightly wealthier, so just about at the poverty line or less, with a large lump sum transfer, those folks will tend to spend it on investment. So they may build a shop, they buy a motorbike, but it'll tend to be investment focused. If you give small amounts over a longer period, and you target the poorest of the poor. So this is the blind 70-year-old that lives beyond the last village dirt road. They spend the money on survival, food, healthcare, maybe locking their door so that they don't get robbed. So the donor needs to answer the question of, what are we trying to achieve? Are we trying to ameliorate suffering and help this 70-year-old survive? Or are we trying to incentivize business creation and investment? Because the design of the cash program will really affect it. But before you can answer which design is best, you need to answer, what are you trying to achieve? So happy to talk for ages on this question, but I think it's fascinating, but I often think it's asked without a clear stated objective of what we're trying to achieve.
Thank you, Michael. That was a very, very interesting reaction from your side. And I think also Eduardo Lepore would like to give us some thoughts, I guess, reacting to Alexander's question, or any other comment you may want to share with us. Eduardo, please.
Thanks, Juan. Yes. First, thanks, Alexander, for your question. Yes, the discussion about the conditionalities around the cash transfers, especially the cash transfers to support the incomes with families with children, was important in Argentina in the perhaps last years. But during the pandemic, the flexibilization of these conditionalities perhaps introduced a change in the appreciation of these conditionalities. So in this moment, there are not a big discussion around that. But I think that in the case of Argentina, the establishments of the family allowances in a non-contributory components for the childhood is a social agreement, and is not a question that is in fact. There are a big consensus about this non-contributory component of our social security system. Perhaps in the next years, the regimes evolve, perhaps without these conditionalities that are referred to educational and health controls. But the several analyses and evaluation of impact show the effective result of these cash transfers, especially in the engagement of the youngs and the child in the educational system, and avoiding the working of them. In these days, there are, yes, a debate here around the conditionalities of the social assistance by people that is in working age and receive cash transfer benefits. That is a new problem, perhaps, and it's related with my comments around the background that explains the establishes of Puente al Empleo. And this point is related with the comments of Cristina, especially and a previous question, because we are agree that it's necessary the formalization of job of an enterprise, but we know that it's a difficult process, and it's a process that have to be done in the time, in a long time. But meanwhile, it's very important to protect the incomes of the families with the low salaries, especially that have employments in the lower segment of the labor market, because Christina said, although these people get a job, a formal job, the salaries are so low, and it's not enough to overcome the line of poverty. So in this situation, I think that the family allowances schemes, contributory and non-contributory component of this regime could play a very important role in the next year, because perhaps there are the principal instruments that the social security system have to achieve this goal and to avoid the incentives to formalization of the side of the supply side. I mean, the disincentive to formalization in the case of the workers that are involved in informal activities. Thank you.
Thank you very much, Eduardo. I think we also have Marcelo who raised the hand. So please, Marcelo, if you want to come in.
Oui, Monsieur Alexandre, Madame Christina, merci pour votre question. Ici au Brésil, nous n'avons pas vraiment un débat sur unconditional cash transfer versus conditional cash transfers. En réalité, cette modalité de unconditional, comment le faire give directly, est pouco connue ici au Brésil. Pour moi, c'est une stratégie intéressante, innovatrice, et nous avons besoin de l'étudier melhor pour pouvoir faire des comparaisons et pour pouvoir faire croire le débat sur le propre transfert d'argent, comme nous faisons maintenant. La politique sociale, en particulier le transfert d'argent, nous avons quelques expériences des approchements avec la politique d'emploi en particulier, il y a 10 ans, mais les résultats ils sont très divers. Pour un, nous avons en particulier avec la qualification professionnelle un très bon résultat en termes de l'offre des opportunités que les personnes pauvres nous n'avons pas, des courses de bonne qualité, des institutions qui ont uma reconnaissance publique intéressante, comme le Senai, par exemple. Nous n'avons pas une bonne expérience avec d'autres politiques d'emploi, comme les microcrédits ou les labor intermediation, je ne me rappelle pas comment on parle en français. En particulier parce que les politiques sociales au Brésil, ils ont différents niveaux de développement. La politique sociale, en particulier l'assistance sociale et les transferts d'argent, a une très complexe effectivation et une expérience que nous partageons com les municipalités, les gouvernements subnationaux. Mais quando on parle de politique d'emploi ou même de politique comme le microcrédit, nous n'avons pas un développement institutionnel suffisant pour faire des parcerias qui peuvent donner bons résultats em termes d'effectivité sociale en particulier. Aujourd'hui, ces expériences sont un peu gelées. Nous espérons que no prochain gouvernement, nous pouvons réactiver les partenariats avec les politiques d'emploi en particulier, et aussi d'amplier les débats sur différentes stratégies pour faire les transferts d'argent, comme nous avons vu ici. Merci.
Merci beaucoup, Marcelo. Thank you very much for these thoughts from your Brazilian experience. So we are approaching the end. I think we still have a few minutes. So may I kindly ask the panelists and the discussants for a one last 1 minute intervention, just to share a final thought, if there was something you didn't have time to share with us, or the main takeaway that you get from this session, we would very much appreciate it. Just something very short, but like that, we can wrap up in time. Thank you, and maybe we can start, unless there is volunteers, maybe we can follow the same order that we had. So Marcelo, it will be you again, if you just want to get across a message of the final conclusion that you get from this discussion.
Je voudrais remercier l'invitation. C'est toujours très intéressant écouter des expériences comme je connais beaucoup de l'Argentine, que j'admire beaucoup. Le BRAC aussi, c'est une organisation très intéressante. Et l'opportunité de connaître, d'avoir connu le Give Directly. I don't know, it's an opportunity to me. Very thank you. Pleasure. Merci.
Thank you, Marcelo, and the pleasure is ours. It was very interesting to hear your thoughts and your experience, your Brazilian experience. Professor Lee, may we hear one final thought from you, please?
I'd like to share one of the interview I had with municipal welfare officers working at the Employment Welfare Plus Center. She said that she actually connected many people on the social welfare system in Korea to employment center. So I had an interview with her, and she said, before she came into the job center, she didn't know there's a job center helping people there to find a job. And then she said, actually, social welfare system, it's just giving the money. Except giving the money, there's not many programs helping people raise up their dignity and skilled up and re-employment into the labor market and stand up by themselves. So actually, she found many functions to actually really helping people to upskill and career counseling and finding their goal and actually leading to the job placement from social protection. So I think this, and then I saw many lovely stories that people really in the fringe of a really dangerous situation with a lot of debt, unhealthy, and then there's no way, find a way. And then these all the partners came together to helping just one person from housing and health related issues, also mental, psychological issues, and then helping just one person to re-employ. So I think a connection between linking the welfare, social protection with employment is really important today. Thank you.
Thank you, Professor. Yes, that message is one of the messages you highlighted, and it's very important, and we are very happy to have had you with us. Thank you for your participation. Eduardo Lepore, you may also want to share with us some final comments, please.
Okay, thanks. Well, the formalization is the main way to promote the overcoming of poverty. We agree with that. However, given the low salaries that we find in the lower segment of the formal labor markets, the strengthening of incomes of the workers, particularly the informal workers that could find a job in the formal labor market, require the strengthening of these incomes. And in this sense, the role of the family allowances schemes, particularly the contributory family allowances schemes, could play a crucial role in the next year. That is general appreciation, and I think that this question have not the place in the social agenda that, in my opinion, demands. Thanks.
Thank you also for that very important comment and remark you just made. Okay, now is the turn for Gregory Chen. Please, if you want to share with us some final opinion.
Yeah, so there's so much to talk about, but let me leave it with one last observation from our side, which is that we very much believe that social protection systems need to be around and available for a long period of time. We don't feel that way about graduation itself. We should say we do see graduation as a transitionary investment that ought to be made in the next period of time to help eliminate extreme poverty. But we do see the need for things like graduation and big push investments to become less and less over time, and actually hopefully exit the scene sometime down the road if we're successful. So let me leave you with that. We very much believe, though, in the long-term necessity of a lot of the social protection structures that a lot of you are building. Thank you.
Thank you, Gregory. And again, thanks for being with us. It was great to hear more about the approach that you have brought. So thanks for that. Michael, we've heard from you already some thoughts, but you may want to wrap up with some final comment, please.
Yeah, I'll be quick. I think it's many of us have been doing this for a long time, but there's still a long way to go on this. And some of the new tools emerging on the technology side between mobile money, AI, make the possible even more ambitious than I could have imagined, certainly. So making sure that we take advantage of those tools and keep contributing to them and the learning so that we can continually improve, I think is something that we should all be thinking about. And thank you all. This has been great and I've learned a lot.
Thank you, Michael. We have also learned a lot from your comments. So one final comment from our final discussion. Christina, please.
Yes, yeah, no, thanks a lot, and thanks to everyone really for this extremely rich and interesting discussion. I think for me, if I can reflect, I'll have kind of one final reflection. I think we have heard in this session and also in others how important it is really to build universal social protection systems that are really have the capacity of protecting everyone throughout their full lives. And I think this is really a critical point that we all strive for in different contexts. But I think building those systems and also addressing the elephant in the room that we haven't really talked about, which is kind of the financing and making sure that the financing is equitable and sustainable. But I think at the same time, I mean, we know that these social protection systems don't exist in a vacuum. And so looking also at other policy areas and really thinking about these integrated approaches, which can really help us to find more sustainable and more equitable solutions is really critical. So thank you very much.
Thanks to you, Christina. And I think it's very important, the message that you've been trying to highlight of having this integrated approach across different policies. This is something we also at the OECD Development Center put the emphasis on. Okay, so we are almost in time. I just have a minute to conclude, and I would not like to go again all over the messages that you've shared. I just want to share with you that it was a pleasure for me to moderate this session. I learned a lot, and I appreciate a lot also that we had experiences from countries at different levels of development, low income, middle income, high income economies, from different regions of the world, Latin America, Africa, and Asia, represented by people with different responsibilities and different perspectives. We had international organizations, we had different governments, but also civil society, and also different types of intervention, which many times depend on the objective that we want to achieve with this intervention. So I think diversity of opinions and of perspectives was one of the main important virtues of this discussion. I think even if there are diverse types of approaching this problematic, there were also some connecting points between them, and probably we all agree that we need better information for improving the impact of these type of programs and interventions, better coordination across institutions, and of course the use of new technologies is opening up new opportunities for making more impact with this type of interventions. So with that, let me just leave it there. Again, it was a pleasure. Thanks to everyone who has been listening, and thanks of course to the panelists and to the discussion. That was a honor. I give it back then to, I guess, Antoine, so that you can take us to the final comments and final concluding remarks.
Thank you very much, Juan, and thank you so much to all participants, all speakers, and everyone in the audience for attending. I think we had a super rich second day of the policy dialogue, where we covered both very fundamental questions of universalism versus targeting, conditionality versus unconditionality, but also very applied operational questions. That was really super rich and interesting. Now, I'd like to pass the floor to my boss, Alexandre Kolev, who is the head of social cohesion at the OECD Development Center, for his remarks on this entire policy dialogue. Over to you.
Thanks, Antoine. So dear participants, I mean, we are about to close this third meeting of the policy dialogue on social protection and development, which this year was dedicated to the sharing of knowledge and country experiences on the role of social protection in times of growing poverty and vulnerability crisis. So our main objective with this policy dialogue was really to provide an interactive platform for peer dialogue, experience sharing, and mutual learning between member countries of the OECD Development Center and members of the USP2030 initiative. I guess that in this respect we have collectively been very successful. I guess these 2 days of the dialogue have been extremely rich. I think we had an opportunity to review a number of very interesting initiatives and to learn from each other, which is really the purpose of this policy dialogue. I believe that this dialogue has been also an important contribution to the Universal Social Protection Agenda. And I would like to thank, again, all our speakers, discussants, and participants, as well as the organizers and interpreters for delivering on our objective. And as you know, this year was really the first time that we had co-organized this, policy dialogue between the OECD Development Center and the USP2030 Secretariat. So, our discussion has been very vast yesterday and today. I think we have asked ourselves, a number of very important questions on the way social protection system can really adapt to a volatile inflationary environment and ensure food security. This was discussed as part of session 1. Then we had a discussion on the role of social protection to shield populations from environmental degradation and climate shocks during our second session. We then had a very interesting discussion on the role of targeting and universalism in the context of increasing social protection demand today, this afternoon in session 3. And we actually had this fourth session looking at the way actually social protection programs can be better integrated with employment and broader economic policies in order to really sustain livelihoods in the longer terms. So we will be, of course, producing minutes of this very rich discussion. Maybe a few thoughts from my side to conclude in terms of, a few takeaways that I want to leave with you. First, as food and energy prices soar, I think we have highlighted the urgency of reinforcing investment in national social protection systems. And we have started to identify those features of social protection system that can actually adapt to a volatile inflationary environment and ensure food security. So in the case of Brazil and Senegal, we have heard how the expansion of cash transfer was instrumental in protecting the livelihoods of vulnerable groups. We have also seen other policy responses to high food and energy prices, such as tax cuts and subsidies in the case of Capo Verde. And from also the Irish aid experience, we have heard that cash programs are also not enough and need to be complemented by and integrated with other programs in order to lift people out of poverty in a sustainable manner. Second, I think it was clear from the discussion that integrating social protection with broader emergency response mechanisms can play a crucial role in sheltering populations from adverse socioeconomic effects of environmental degradation and climate shocks, as well as to facilitate the structural transformation of economies to cleaner consumption and production patterns through what the ILO call a just transition process. Yet, I think as pointed also by some, including Bangladesh, this requires a whole government approach, and there is also a need to ensure that those new jobs that may be created as part of the green transition are decent jobs, and this remains a challenge. Moreover, I think as mentioned by representative from France and Zambia, for social protection system to be able to effectively address environmental risk, there is a need to collect better data to monitor environmental vulnerabilities and anticipate environmental risk. Third, I think we also had a chance to revisit the issue of targeting versus universal programs in social protection delivery, which has been long debated. And we have heard that while concentrating a greater share of benefits on the poorest people has been considered by some as more cost-effective, more pro-poor, and more fiscally sustainable than expanding coverage more broadly. There are also concerns of a large exclusion errors, and some have pointed also to better poverty and redistributive outcomes of universal approaches. Finally, I think we had the confirmation that in order to sustain livelihoods in the longer term, social protection programs need to be better integrated with employment and broader economic policy. So I'm going to stop there, and I wish you a very good day or evening. And I will now like actually to give the final words to Ayumi Yuasa, the Deputy Director of the OECD Development Center. So Ayumi, over to you for the final words.
Yes, thank you, Alex. As Alex said, my name is Ayumi Yuasa, Deputy Director of OECD Development Center, and I'm very honored to meet you all, especially because prior to joining OECD, I had worked on many projects of JICA, Japan International Cooperation Agency, on extending social protection coverage, including to informal economy and also developing sustainable long-term care programs across continent. And let me concur, Alex, to congratulate all our participants for a great start meeting of the policy dialogue on social protection and development. We were glad to benefit from the experiences and expertise from no less than 12 countries and several major multilateral and non-governmental actors. We are particularly pleased to join forces with our colleagues of the Universal Social Protection 2030 Secretariat, co-hosted by the ILO and the World Bank, with whom we now co-organize this yearly event. As Alex said, the Secretariat will now summarize the key outcomes of this meeting, and let me reassure you that these will feed the work by the Development Center and other partners on social protection. Our intention is also to deepen our empirical and policy work on this topic through our program of work. We therefore ask our member countries of the OECD Development Center to continue to support this initiative through knowledge sharing as we are doing now, but also through voluntary contributions so that we may undertake additional research and policy work on social protection in this changing international global challenges. Such work could help feed the dialogue and add depth and evidence to our discussions. The center can take on global and regional comparative studies as well as country-specific reviews on a demand basis on improving their social protection systems and financing social protection. The policy dialogue is as useful as you want it to be. So it is a member-driven public good facilitated by us, the Secretariat. And in fact, we are so pleased to receive so many enthusiastic suggestions of speakers from our member countries for this third meeting. We hope to keep this momentum going for the post-meeting next year. Finally, special thanks to the USP2030 Secretariat and the steering committee members of the policy dialogue who have helped design the agenda of this third meeting, specifically Argentina, Brazil, France, Ireland, Morocco, Senegal, and Uruguay. We count on them as well as on the USP2030 Secretariat to prepare the next meeting, which will be held around the same time next year. Thank you all again for the wonderful discussions and looking forward to meeting you soon, online or in person, at latest in the fourth meeting next year. Thank you very much and have a good evening or good night. Thank you.
Thank you. Bye-bye.
Thank you, everyone.
Bye-bye. Thank you.
Bye.
Bye-bye.
Merci. Au revoir.
Thank you. Bye-bye.